I don't think I gave you who I am. I think you all seen who I am. I'm the chairwoman of the Spokane Tribe of Indians, and early in my career, I was the executive director of the Housing Authority for the Spokane Tribe. So I think that might be why I'm here. However, that was 30 plus years ago, maybe 40 plus years ago. I lost track of time. But anyway, so I'm opening this session, talking a little bit about how we're going to do things, and I wanted to give you a little background about my tribe. My tribe is in eastern Washington, the Spokane Tribe of Indians, and the historical homeland of the Spokane Tribe is eastern Washington, about 3 million acres, including where the city of Spokane is. And my people were a salmon people. At one time, the salmon made it all the way from the ocean, all the way back up to Spokane Falls and up our creeks. And so we were a river people like many of the tribes throughout the Northwest. We've been without salmon for about 100 years now, and my people, my elders will tell you, bring back the salmon and we can heal. And so that's an important statement. We can heal. And all morning today we've been talking about drugs, opioids, and fentanyl, and the impacts on our people. And we've listened to the stories of some of the people in our region and how it's impacting tribal people, what the impact is for tribal people. And it's very severe because we experience trauma. Our people have experienced trauma. We call that historical trauma. And so for my people, the loss of salmon, our people being sent off to boarding school, that's the beginning of the trauma, and it continues on through the generations, and we continue to see it in our children and in the form of social and emotional things that happen with our people. And unfortunately, it comes out with drugs and the impact of all of the drugs that has happened to our people as a result of experiencing trauma and having trauma in our lives. I myself too am impacted by drugs. I had a daughter. My middle daughter was addicted to opioids. Very, very severe case. I thought we were going to lose her. And it was just like some of the stories today. I would lose sleep. I would want her to call. She wouldn't call, but when she called, I would always go to help her. And after about 3 times of inpatient, she finally ended up in Northwest Treatment Center in Elma, Washington, where she really got the cultural treatment that she needed, and then came home and has been drug-free for many years, and now has 3 beautiful daughters and married. So that's a success for me. But also in my family, I have a nephew that's impacted by, I'm not sure if it's fentanyl, opioids, or if it's meth, because the last person I talked to on Friday at work was him. He come and visited me, and he's in a different reality. He talks about who he is, and everything he talks about has nothing to do with who he really is. In his terms, he's married to J-Lo, he owns all the national football leagues, and so it's a real sad situation because he's lost. He's lost to these drugs, and so we're all impacted by this. Across the whole state, we're impacted by the impacts of drugs. And so drugs consume us. It destroys families. Ones that get involved in drugs, they steal from the ones that they love. They become homeless, And one of the saddest things is we have so many drug-impacted babies that are born into our communities. So it's just such a huge impact on the tribes and the state of Washington. So it's really necessary that we work together to try to come up with solutions. And so today, what we're asking everyone to do is to participate. When it's time for the public to speak, when it's time for you to speak up, we want you to offer what you feel we need to do as a result of drugs, of the opioids, of fentanyl, and housing, and homelessness. What are the solutions? What are the things that we can bring up to bring to the governor tomorrow? We want to find ways to identify the areas of concerns and changes that can happen as we talk to the governor tomorrow. We want to formulate what a tribal state partnership to combat the opioid fentanyl crisis looks like in regards to housing and homelessness. We want to identify areas where legislative intervention is needed. And we want to create recommendations for institutional and systemic change that is brought directly to the governor for day 2. So that's what we want to do today, and we really are going to need your input as we go through this afternoon session so that we can really formulate some good examples or good solutions to the problem of homelessness and home issues in regards to the drug, opioid, and fentanyl crisis. You know, most tribes deal with housing under what we call a tribal designated housing entity. And for many, many years, tribes dealt with housing from HUD, Housing and Urban Development. And with those programs come rules and rules and rules, many rules that are not conducive to people who are addicted to drugs or to drug dealers. So a lot of times what happens is we have drug dealers and users are evicted from housing, and they're banned from those housing units, those rental units, from coming back to live in those homes. And so then on a lot of the reservations, there isn't an alternative to housing. So they become homeless, or they end up living with extended families. And so I think what's really important today is that we realize that we have to consider alternatives to people that have issues with drugs and with the opioids and fentanyl. We have to find ways to help them. And this morning we did hear some good things that some of the tribes are doing, and in the next section that I talk about, I'll talk about some of those things. So now we are going to go ahead and have Ted come up, and he's going to talk about some of the things that the state is doing regarding housing and the drug crisis.
Thank you, Chair Evans. We could get the slide deck going there. Good afternoon. I'm Ted Kelleher. I'm the Housing Policy Director at the Washington State Department of Commerce. The Washington State Department of Commerce is the housing entity in the state level that deals with housing. So I'm going to talk today mostly here to listen. I really appreciate the blessing it is that you've invited the state and our agency here, and hopefully you'll challenge us in ways to think differently about what we're doing. I oftentimes think about what I thought and said 10 years ago, and sometimes I cringe, and I'm hoping you can tell me the things that I'll learn so that 10 years from now I'll be better and I won't, have to cringe so much because of the things I used to say. Help us develop. So I'm going to, real quickly, I'm going to do some basic housing, just a basic housing status in Washington State. Why is housing so expensive, real quick. I'm going to talk about how funding flows from the department. You know, one of the things is, as mentioned, the federal money is the biggest housing investment in Washington State is federal money, primarily from housing and urban development. We're the state, and we have a different flow of funding. And I would say, and I'm happy to have you argue with us, but that and help us do better. But the state funding is much more flexible. So we really do want to get into some of the things you're seeing that are going wrong in housing, and then understand that the state money can be more flexible and is more flexible than the federal money, and push us to provide the level of flexibility and focus that you need to be effective. And then finally, I'm going to talk a little bit about some of the policy directions and that came out of the recent legislative session. So just, one question often I get asked, and I wonder myself, and this is a very complicated subject, we could spend a couple hours talking about it, but why is housing, why are the price going up so much with rental housing and purchasing housing? So just real basic, there's a lot of factors going on here, but one of the key ones is that now each one of these dots, this is from the Census Bureau, each one of these dots is a community in the United States, what's called a metropolitan statistical area. This is every single metropolitan statistical area in the United States. So what you see here on the bottom is household income. This is median household income on the bottom. And so you'll see, down to 15,000. These are places like, West Virginia and places like that, up to 135,000, and you can see Seattle here at 115. So those are incomes. And then here is median monthly housing costs. So this is both home ownership and rental costs combined. I won't explain how that works, but so as you see, as incomes go up, you see housing prices go up. This is a very strong relationship. Now you can break away from this relationship somewhat in that you'll see there's places that are below the line, meaning that their housing is cheaper even though their incomes are high, but you can't escape. There's no place that has a $35,000 income that has really expensive housing and vice versa. There's no place with $100,000 a year household incomes and cheap housing. So this is critical. As we see incomes increase, we see prices increase. So what are we seeing in Washington State? Well, we're seeing incomes increase faster than almost anywhere in the United States. We see, here's King County and Snohomish. This is in absolute terms. This is actually old data. King County is what 120,000 a year now. Snohomish 100,000, Washington 84. Above most of the United States is at 69. And this is from 2017 to 2021. You're seeing significant increases. If you adjust that percentages, you're seeing Washington had a 20% increase in incomes. And with those increases in incomes, all things being equal, you're going to see an increase in housing prices. So when you see that price tag go up, that's a lot of what's going on. Not everything, again, that would be a long conversation to talk about everything, but this is sort of the short version. So one of the things is, so if your income's going up in the middle, for people in the middle, their income is going up, the median income going up, their housing prices are coming up. And what you're seeing actually, and there's different story at the margins, but in the middle, literally the median, which is, if median from mathematical terms, you take all the households in Washington State, and you find the literal one household in the middle, that's the median. So this is the problem with statistics, right? They don't speak to everything, they just speak to the averages. But so the ratio of housing costs to income in 2011 was 24%. So people were spending in the middle 24% of their income on housing. As we go forward to now, it's actually down a touch. Now, this is statistically not super different, but if anything, it's lower. If anything, housing is more affordable because incomes have been coming up and housing prices have been coming up in the middle. But that doesn't mean we're not seeing increasing problems. We're seeing more. This is the number of housing, the renters who are cost burdened, meaning they're paying more than 35% of their income for rent using this measure. And you can see it's risen from 38% to 40% in Washington, 378,000 to 411,000 households, so that's an increase. So there's more and more need And you can see it different. Actually, you know, we're doing better than Texas in terms of they're having even more of a surge of unaffordability. And so one of the things, so again, at the middle, things might look pretty good. The market is working well, quote unquote, in that it's delivering housing at a price that matches people's incomes as their incomes come up. But at the margins, what you see in the national data, and you see it very strongly, is that an increase in, as rents increase, you see more and more people living outside. So the data is pretty clear. Roughly speaking, $100 of rent increase is associated with a 9% increase in homelessness. So you see this is a rent increases from 2017 to 2021, well more than $100 in most communities. In Texas it was 180, and Snohomish 291, King County 256. So you're seeing these increases in rents, which is driving an increase of people at the margins having a hard time staying inside. So, well, you know, one of the things when you look at places like Washington State is clearly having a problem with opiates and fentanyl, for sure. You'll actually see that problem's worse in other places, but they're not seeing the level of homelessness that we are, and there's layers to that. But like classically, West Virginia has a lot more opiate abuse than Washington State does, but you're not seeing a lot of people outside because their housing is so much cheaper, their incomes are so much lower that when you're at the margin of society, you've lost your job, you're having a hard time, you're able to stay inside with those problems. Whereas in Washington State, the bar is so high on rent, and this is not just King County, you're seeing this. Originally it was mostly the Puget Sound corridor, now the rest of the state has surged and caught up, where your rents are high, so that if you're struggling at those margins, you have a hard time staying inside. And as you can predict, and again, there's some nuance here, but you're seeing an increase in homelessness over time. So I'm going to pivot now to probably the more interesting part of today, which is, you know, how does the funding flow? And just sorts of basic, you know, basic housing civics about how the resources get allocated. So again, the federal government is the biggest player, and the primary way they distribute money is from the federal government straight to local housing authorities, and that includes directly to tribes also. At the state level, different funding source, more flexible, albeit smaller. The money for operating homeless housing, which goes from Commerce to county governments, and this is like a formula grant primarily. And then the county governments then allot money to local nonprofit housing provider and tribes. And I'm not saying this is ideal, this is just where we're at right now. Maybe that's part of the conversation we have. What does is this flow the right way to do it? For capital money, which is like I want to buy a building, I want to buy some land and build a building, funding goes from Commerce directly to local nonprofit housing provider, housing authorities, and tribes. So it's a different model, but that's the way it flows. So I thought about just doing this slide because I think one of the things that gets very confused, and just setting aside everything else I said, one of the things that gets very confusing in the housing conversation is we get deep into the tactics, and tactics are really important. Like, what kind of housing are we going to provide? Who's going to get it? Like, what are the services that we're going to wrap into that housing? Is it temporary? Is it permanent? Is it sobriety-based, et cetera? Those are all critical issues and something we should talk about. And sometimes I think there's some confusion with what feels like, oh, I can't get the housing, there's long waiting lists, that we're serving the wrong people, when really the way we've set up the system, we have to triage. We have to triage. It means that we have to turn people away. And you can passively turn people away through things like waiting lists, or only people who get housing are people who have a good relationship with their social worker, or they happen to be in one zip code versus another, or there's like a sophisticated scored system to decide who gets in, sobriety-based versus dealing with people who are most at risk of death, et cetera. But at the end of the day, for every 2 people living outside, there's only enough emergency housing to bring 1 inside. So you could change all the models you want, you could switch, you could have a perfect system. At the end of the day, there's only enough beds for half the people. And you can talk about efficiency, and I can do a 2-hour presentation on efficiency and tweaking, but maybe you're going to get 10-20% efficiency, so maybe you get effectively more beds, but at the end of the day, you're going to have to decide when you've got 10 people outside, there's a decision. Either we're going to passively make it or actively make it. Who are we going to bring inside tonight? A separate but related issue is for every 4 eligible people for subsidized housing, so they're not outside, but they're low income. For every 4 people who are eligible for subsidized housing, we only provide a subsidy for 1. So one analogy that I think about this is with food assistance. With food assistance, if you reach a certain income criteria, and you could argue about whether it's a good income criteria, you could argue about whether the food benefit is adequate, etc. But at the end of the day, if you qualify for food assistance, you get food assistance in Washington State. It's similar with Medicaid. If you are eligible for Medicaid or under Obamacare, the expansion for subsidy for your insurance, you get that. It just happens. Again, you can argue about it, whether it's adequate and those sorts of things. When it comes to housing, we don't have that system. We have a system where there's a fixed amount of money, and then effectively what happens is for every 4 people who are eligible, we only serve 1 of them for the affordable housing. And then on the last bullet here, so, I've read the research papers and then more recently, lived it in different ways, and some of you have probably lived it too, and sort of seeing it firsthand. If you offer certain types of housing to some people, they're not going to move into it. They're just not. Classically, a place that people aren't going to go is if you have a large room, let's say an auditorium, and a bunch of cots, and there's a sobriety requirement, you're just not going to get everyone to move into it, period. So you will see vacancies in programs like that at the margins. Even if you changed all the rules, there's still not enough spaces. But anyway, what we've seen in firsthand, and I won't do that presentation now, and this is a very conservative number. This is, I know we can actually do better than this, but this number actually comes from recent experience dealing with people living on the sides of our highways, which are, definitionally people who've gotten to the point in their life story where they're living in a tent next to a freeway. I mean, that's a very high acuity. There's a lot going on there. When we're dealing with people in that situation, and even in kind of a rushed way, not the most thoughtful way possible, but just, hey, what are the options we can quickly deploy to get people inside? We're seeing more than 90% can come inside, and we know we can even do better than that. And that's, again, with the highest acuity. So I just want to really push back on the idea that we can't bring people inside. We can bring people inside. The state strategic plan is about leaving no one outside, and we can really do that. So I'll wrap up here with some new directions for coming out of the legislative session and just generally. So it's been actually in development for a few years now. Historically, the way the capital financing worked, it was competitive, and there was some effort to split it between urban and rural, but basically it was competitive, and whoever could put together the best application would get the funding. The problem with that system is if you successfully, once you've built the capacity to put together applications that get money, you're more likely to get one next time too, right? So that it's really hard to break into that system. So you had organizations with high skills, typically on the Puget Sound corridor, able to compete with that funding, and it was harder for organizations that were new or in more rural areas to put together applications that were successful. So one of the things that's coming that we're just on the Department of Commerce is on the edge of implementing technical assistance to help historically marginalized communities compete for the capital funding. And in fact, in this last legislative session, 20% of the trust fund portion of the money, the capital financing, was set aside for organizations governed and served by historically marginalized communities. So this is something we need help with. I mean, we've done some of this sort of work in the past. It's not like we've never done it, but we've never done it at this scale and with this intention before, where we're going to be engaging communities, including tribes, who historically have not gotten their fair share, and talking about what that fair share is a evolving conversation too. But what does it look like to help those organizations put together a good application, have the organizational capacity they need, and the capacity they need to not only get the money, but then to successfully operate the programs? And then finally, just, this is a little bit of a side note, but it's just so all-consuming in our world, I just feel like I can't not mention it. Thanks to Representative Macri and the legislature and the governor, there's a lot of funding out there. So when COVID happened, as many of you have probably experienced directly, a lot of federal money came in. But that was all one-time money. That money is falling off now. A lot of that money was used to open emergency housing. That money is running out now, in some cases already or in the next few months. That money will end, and with it, more than 2,000 shelter beds are going to close, but for the legislature and Representative Macri, who's here today, can't thank enough, providing funding to keep those shelters open. So one of the things that's happening right now in your communities, and I'm partially mentioning this as an opportunity, is that money is going out in the upcoming weeks to keep those existing facilities open, and we need to really engage with that process. So as I wrap up, one of the things is we're talking today about housing. This is the housing session, and there's other sessions for different sorts of things, treatment being one of the primary ones. And I don't want to create an artificial silo. We should let the conversation go where it needs to go, and really encourage you to challenge us to do better. But housing, as we typically see it, is a place like where you have a lease or a mortgage, right? And you've got all the tenant rights that are associated with that. That's classic housing. And then one of the things that we also finance is like emergency housing, which is more like shelter or transitional housing. Housing is therapeutic in itself. When you look at the research, just being inside all by itself is important in so many ways. It's important for your physical health, it's important for your psychological health generally, it's important for recovery. It's very hard to recover when you're not inside, when you're struggling with just basic survival outside. But housing isn't treatment, right? So again, I don't want to over-press this issue because there's obviously some blurriness, but it's important to think about that operationally. When we're thinking about treatment, like inpatient treatment, or like a hospital type setting where you don't have a lease, where it's a licensed facility, it's licensed by a state agency, it's a care model, people are coming into your room without asking you first. Like when you're in your apartment, people, you have tenancy rights. So that's there's a difference there, and this session is technically about housing. We can talk about other things too, but it's really important that's housing. And I think one of the things that I've described in these slides briefly, and when you look at the numbers as a whole, we need enough places for people to be inside. And there's a really important, robust debate that it's based on values and tactics and politics and numbers, but we need enough places. And what are those places? Some of those places are housing places. Some of those are places where you have leases. Some of those places look like shelters. Some of those places look like treatment. Some of them look like an involuntary place, and there's different arguments around that for sure. Talk about contentious issues, involuntary behavioral health treatment, and then of course jail and prison. But any way you do the math, like whatever your values and politics are, we don't have enough of those places, period. Like you could add up all the places I just described and then look at all the people living outside and who are suffering with fentanyl and other substance abuse disorders. There's not enough places to bring people inside. So we need to create enough places, and then we need to talk about the mix of those places and the tactics associated with those places where people are inside. So there's so much more I could say, but I really don't want to go on and really want you all to challenge us. So thank you.
All right, so thank you, Ted. And I think when you talk about there's not enough housing for all of those different needs, whether your inpatient, outpatient, all of those, even inpatient, outpatient, incarceration, they all provide, those type of facilities provide your place to stay. But as you come out of those places, you need some type of place to stay. As you come out of those places, you need a success for moving back into the society. And housing impacts everything dealing with opioids and fentanyl. It's impacted by that, and it impacts that. So if you're coming out of these facilities and you don't have a place to go, like transitional housing, or to a place where it's safe, where you can get wraparound services, your chances of succeeding are not good. So I think as we talk about the tribes and the reservations, we have to remember that we're coming from the reservations where we have this traditional tribal designated housing entity that kind of limits who they can house. They house low-income people, and they have a lot of rules that have been established over years, like I said earlier. And so a lot of times, if you're having issues with drugs, a lot of times you lose out on those housing opportunities. So you end up out in the fringes, and eventually, as your drug addiction gets worse and worse, you become homeless until you start to turn yourself around. So a lot of the tribes have recognized this problem that we don't have enough housing for everyone. So some of the tribes in Washington State have done some pretty amazing things in trying to identify different ways to meet the housing needs of our total population, including people that are not eligible for the housing that's provided by the traditional housing entity. So some have actually, they were able to use their CARES dollars or their infrastructure dollars to build some of their own tribal housing, building homes for single people. Another thing with the tribal designated housing entities, they don't always, the ones that are single don't always get up on the waiting list and actually get housing, so they end up living with their parents or living with extended families. But some of the tribes have actually built their own tribal housing. They set aside housing for those who don't qualify for HUD. Some of the tribes have built apartments for single people. But what I'm told by those tribes is they may build apartments for 16 people, but they might have 100 people on the waiting list. So even before they open the doors, they're still not serving all of the people in need. They're still not providing for the housing of the full population. And that's a lot of what Ted said towards the end of his discussion, is we just don't have enough housing for everyone. Some other things that tribes have done, they brought tiny homes into place. So they have these small tiny home villages where they can bring in people, whether they're bringing in people from treatment, and they use wraparound services to serve those people, or whether they're just building a tiny home villages for single people as their first opportunity to buy housing or to rent housing, so they eventually can purchase tribal housing. And another thing is transitional homes, very important thing as we talk about people in recovery, people coming out of in-treatment. They need a place to stay, and those transitional homes will provide for that need. And then the tribe and the tribal departments that serve them can provide those wraparound services. And so the goal for the tribes is always to have a safe place for treating substance abuse disorders that are culturally appropriate. And so as the tribes try to provide the services, as they have these people that come from treatment into the tiny homes or into the transitional homes, they provide services for them and the wraparound services, including things like for transportation, mental health counseling, drug addiction counseling, training and workforce. And they have these care offices, like you heard Kelleher talk about how they have a care office for people in recovery. So it's real important to acknowledge that the tribes know that the traditional housing that we've had in the past hasn't worked for us across the board. So it's important that we provide other means. And when I think of how can we partner with the state, we need to find ways that we can develop this alternative housing to help our people in recovery actually recover and actually be able to move from inpatient to a transitional situation and move on to another type of housing, so that as they heal over time, as was discussed this morning, sometimes that takes a year, 2 years, 3 years, depending on the addiction or how long the person was living an addictive style. It can take years. Another thing with tribes is many of our tribes, at one time, the majority of our people lived on the reservation, and that's true for my tribe. At one time, there was probably 90% of us living on the reservation. But as time has gone on, and as everyone has a vehicle, a lot of our people have moved off the reservation. So in my tribe's case, about half of our tribal people live off the reservation in the cities. So as they move to the cities, they deal with the problems of rent, of finding housing, affordable housing, and a lot of times they end up multi-families living in one unit. You know, you'll have a house with 2 or 3 families in one house, and that a lot of times causes many problems. We just don't have stable housing across the whole spectrum. So we have a lot of times the tribe itself's not able to help those people that have moved to their city because we have these boundaries, these service areas. So the Spokane tribe may not have the service area in the city of Spokane, so we can't provide some of the services that we would have otherwise because it's not our service area. We need to get that changed in order to help our people in those cities. We do have, with the cities, we have a lot of other nonprofits that try to help the people with homelessness and with housing needs in the cities. So some examples of those organizations are the Chief Seattle Club, American Indian Center in Spokane, Native Health in Spokane, and Mother Nation. As I talked to some of these different organizations, I was really impressed by Mother Nation. What they told me is they will help the people that can't be helped by anyone else. If there is a mother with addiction issues, with drug issues, she has families, they'll find a way to put them into housing. So I think we need more and more of those kind of programs to help people as we change over time, as our people move from reservation to reservation or from the reservation to the cities. We need to work together even more than we have in the past because our people are moving all over. And so things like housing vouchers, you know, we need more opportunities to provide housing vouchers for people because we can't go build homes for them where they are. And a statement was made this morning as people in recovery or people with addiction, we always hear the statement that, well, we don't want those type of people here. We don't want those type of people here. We even had a problem with the Seven Nations, the Healing Lodge in Spokane, where when we first built that youth treatment center in Spokane, the surrounding people didn't want the youth treatment center there. But over time, the youth treatment center developed into something that was working well with the neighbors, so now it's well received and well received by the community, the surrounding community. They're good neighbors, so I know we can be good neighbors in those situations, and it's important that we work together in the cities with homelessness, with the city councils, with the city programs, the other tribal entities that are in the cities to help prevent homelessness, because it's a serious problem. So those were a few of the examples that I wanted to talk about. So I think we're ready to start moving on to get some group discussion from the people in the crowd. So I think we want to go ahead and open it up so we can hear what you have to say about opioids, fentanyl, and housing in your communities, and what areas of concern do you have, and what changes would you like to see happen? And recall, we're trying to go forward tomorrow with some recommendations that we can provide to the governor. So I'd like to go ahead and open it up, and we'll kind of co-facilitate, huh, Ted?
And we have 2 mics, so if you just want to raise your hand, either Janet or I'll bring a mic to you.
Hi, my name is Teresa Lehman. I'm from Jamestown. You talked about Mother Nation, and I've heard that twice in the past couple of weeks, but I don't know much about Mother Nation. Can you tell us about that organization?
So they are a 501c3, and they are located on this side of the state. I believe they're either in Seattle or Tacoma area. And I have a pamphlet on them, but what they do is they try to serve the population that, say, Chief Seattle Club can't serve, or the American Indian Center, that those centers, the programs, those people can't qualify, they'll try to serve their needs. So they'll provide wraparound services. They'll try to get them housing, they'll provide for food. If they need counseling, they'll try to refer them for counseling, and all of the services that any that they would need. And so they told me that they will not deny anyone. They'll try to help them.
White and J. Squeeze to Huskeen. My name is Karen Conan. I'm the Vice Chair for the Caldwell Business Council, Caldwell Tribes. It's good to see our housing executive director here, and I don't mean to put him on the spot, but we talked with Doug about a number of things on trying to address the homeless issue, and it's so complex, but at the same time it seems so simple when it's not. Especially when it comes to having to develop policies that deal with families. You don't want to put a single mother with children in a tiny home complex that also houses predators, for lack of a better word. And so we need to take all of that into account when we're looking at and talking about homeless shelters or even tiny home complexes. And so we're always asked, well, why can't we just give away tiny homes to everybody? And And first of all, we don't have the funding to do that. But second, when it does come to a complex, like I said in the beginning, is that there are policies that have to be developed to make sure that the vulnerable children are not affected by anybody that may have a record or that may be a predator or anything like that. And I don't know if Doug wants to say anything, but he is trying to address some of those issues, which I think is fantastic, given that there is some funding available through the feds. And so, you know, I don't, oh, good, she's giving him a microphone so he can talk about those details. So thank you for coming, Doug.
Of course. Thank you, Karen. So most of the housing authorities are driven by federal funds, and I think the gentleman's name?
Ted Kelleher.
Ted, I would agree with you that the state funds probably are a little less restrictive than the federal funds. And, you know, we were able to do some different things if we could tap into the more state funds. I don't know a lot of programs in the state besides Commerce you mentioned, or that you're director of that fund, Tribal Housing in Rural Communities. If we could ask that question and help us understand which programs those are in the state, and Commerce in particular, which those fundings are, because I sit on a Okanagan County community action. I don't know what they call in the rest of the state, the western part, for example, but I know that the state funds funnel through that kind of entity, and most tribes are left with receiving block grants through federal funds 100%. So if we could tap in, if we could find ways for tomorrow's message for the governor would be to open up more streams of funding from the state to the tribes with those less restrictions, so we could serve those vulnerable folks Karen just mentioned, that including addiction folks.
Thank you for that. I think one of the slides, and I mentioned that, I mean, maybe this wasn't the best path, is that, you know, if you're on the CAP board, that's where the money is probably mostly flowing. Like, it technically goes to the county, but in most places, particularly rural places, the community action program plays sometimes all of the role of allocating that homeless housing operating funding, which flows to the counties. And then again, the capital funding goes straight to the nonprofits. During the pandemic, the department experimented with, you know, there was a lot of new money that we had to get out quickly. One of the things we experimented with was explicitly setting aside some of that money for tribes and urban Indian organizations. And then the legislature has put some of that in a broader cast for historically marginalized communities. So I think, you know, one of the questions on the table, and I don't actually have there's some advantages clearly to the way we're doing it now. So I don't have like a secret answer that I'm holding back. I really do think we need to dig in. What does it look like? What does this relationship look like? We did some experimentation with working directly with tribes and urban Native organizations, but I don't think we've got it quite right for sure. And especially with the capital money, there is a specific, it's not just, oh, we're kind of do it. There's like a whole set of people, most of which haven't been hired yet, whose job it is with that 20% of money, capital money, to get out there. And we have some ideas about what those tactics look like, but what does it look like to actually deliver? What does it look like to actually have a fair or equitable or whatever word you want to put on it? What is that number? Is the number the right way to measure it? I think there's a lot of work to be done, and some of it's going to be happening. We did some experimentation about what that looks like, but we're going to be diving into it, and in the next 24 months, we're going to do things that hopefully bring us closer to the world we want to be in, but help us do it better, more quickly, and get through the mistakes more quickly, and get to the place where we feel like there's a system that works, that has the right relationship between the state funding and the way that those limited resources get out there. And you know, one of the things I just wanted to throw in there, the governor and others were really looking to address scale in this last issue, so that we weren't having to make these really hard is the wrong word, like impossible to make the right decision when you're turning people away. And the governor asked for $4 billion. There was other proposals out there. Out of the session, this was an unprecedented session, and the resource investment has gone way up, and that is to be appreciated. But it was not at the level ultimately that the governor asked for. So so I think there's two dynamics. There's getting better about distributing the money we have, and with tribes in particular, and figuring out what the evolution of that relationship looks like, and bringing the resource up. So it's just not a fight for every penny where you end up pitting organizations. I mean, it's not a good situation when you have a resource limitation. It's never going to feel good or be good.
Hello, my name is Ruben Twin, and I actually work with Mother Nation. And so I'm one of the program managers that work with Mother Nation, and we are located out of Seattle, Washington. And I can explain a little bit more about, as Mr. Kelleher had shared with our program, we have a couple types of funding sources that allow us to do this kind of work. A lot of it is flex funding, unrestricted funding, which really allows us to do a lot of work. Working with the commerce, and then also working with city government as well, and having that relationship with city government, and understanding that there's barriers that sometimes people outside of Indian country really do not understand and see. And one of those barriers is historical trauma, and having culturally appropriate care for that, and culturally appropriate wraparound care services. And as they say with that term, by and for, having that understanding of what by and for really means. And for those that lived in King County out here, we have Bernie Whitebear, who was with the Native American community. We have Bob Santos, with the Asian community. We have Roberto Maestas with the Latino community. We have Larry Gossett, with the African American community. Those were by and for organizations that were established in the 80s, and they were by and for because we understand how to take care of our people. And then we got into another part of programming where we started saying, we know what's best for your people. And now we're getting back into the by and for process, and understanding that one of the barriers is sometimes, like, as I said a little earlier, when you're fleeing DV, sometimes you cannot grab your ID. Sometimes you cannot get to your tribal ID because you need to leave that situation immediately. And so when you contact Mother Nation for our Yahawi program, we understand that, and so that's not a barrier for us that says we need to see your tribal ID before we can start you in our program. No, we understand you are tribal. We know you're tribal. We will provide that services for you right then and there. And we also understand through historical trauma, through Child Protective Services, that people were adopted out before ICW was actually enacted. And so we got people that cannot get into our tribes. They cannot get enrolled in our tribes. But when they come to Mother Nation, we know they're Native. We understand they're Native. There are certain things that when you talk to another Native, you understand they're Native. They're in our community. They live with our community. They're married into our community. They go to our culture ceremonies. They're participating in our community. They know they're Native, but because the government said that you got adopted out and now you can't get to those records, that doesn't mean you can't get services through any of our Native communities. Organizations, Mother Nation looks at that, and we can provide that service for that person. That's one of the flexibilities of having flex funds and having unrestricted funds, having donation funds that come in from other places. We also have the commerce funds, we have the county funds, we have an organization, part of our department works for that process. I myself work with a program called Wa'antuan, which in Lakota means we're looking for our relations. We're helping our relations. And that gives me the ability to work from Lummi all the way down to Cowlitz County. That gives me that ability to no longer have those government lines that were established by the government, not by tribes. Tribes collaborated and worked together. They supported each other. That's what the canoe journey is about, is understanding that we have potlatches, that we journey to each other's people and we support each other. When we get back to that kind of concepts, that it's no longer fighting for that piece of pie, but understanding that we all have a piece of that pie and that we share that pie with each other. That's potlatching. That's part of what we do, and part of our process is understanding that there's the relations. And so for Mother Nation, we get to do a lot of things, and we will find those services because we have different types of funds that allow us to have that services. So we do have the commerce, we do have the counties, we do have pirate. And so we understand how to move through those barriers that are put in place, not by us, but by the system that regulates it. And I understand that it really does have to figure out of those two people, which one's going to get that. So those are put in place to make sure that that one person that really does need it can't get those services. But that one person that is still left out is still our relation. And in any country, we will find a way to make sure that they are housed. And so I can share that about Mother Nation.
Okay, got an additional comment, then Representative Macri.
Just a quick question. Thank you so much for explaining that, and hopefully you could come to the east side of the state. I think that would be fantastic. I know funding would be a major issue, but it's something to think about. Just a quick question for Ted. Do you know when the opioid funding will be distributed to tribes?
I'm sorry, I don't know that, but we can, if maybe someone in the room does, or could follow up.
There's going to be 2 roundtables with the Healthcare Authority, and I believe the consultation is on June 20th.
I'm glad that you asked that question, because I was actually going to comment on that. So hi, everyone. I'm Nicole Macri. I'm a state representative from Seattle and have done a lot of policy work on both healthcare and on housing. And I think this has been a really great conversation, and I want to observe a few things. When we're talking about housing specifically for people with opioid use disorder, we have to really think about that integration of healthcare and housing. And I would encourage, as I do encourage all communities, but I would encourage tribes to really think about, as I know many do, how the healthcare services you are providing can be leveraged with the housing resources at the state. One of the exciting things from this last legislative session was that there is a bit of new resource, and it's always easier to implement new approaches when you're not trying to move money around, but when there's actually new dollars. And so the opioid settlement dollars are new resources to the state and to the tribes to try some new things. And the dollars going to tribes, of course, are incredibly flexible. They must be focused on assisting people with opioid use disorder, but beyond that can really be used for anything. So I think there's an opportunity to really think about just exactly what we heard here, like what are those flexible kinds of needs that we can address that bring together the healthcare and the housing. We know that medication therapies for opioid use disorder are the most effective kinds of therapies. Well, we know compliance with medication goes way up when people have a stable place to live. And so thinking about what are the right supports we can bring to people. So number one, we need housing for everyone in our state. Everybody needs a safe, stable place to live. But for people who are in active addiction or working to recover from opioid use disorder, the people need an additional level of support in that housing to both bring them indoors and to provide the healthcare services that we know they're going to need for a long time. So how do we integrate those things? So I will say it has the opioid settlement planning experience has been a really good one, because I think tribes have been really amazing partners to the state in saying exactly what they need. And I would encourage in the housing space that we begin to have similar kinds of conversation, because I think that there could be opportunities for different ways that the state and tribes work together on addressing the needs of folks across the state. So anyway, those are my observations. I work on the state budget. I'm a vice chair on the House Appropriations Committee, so I think a lot about the resource and how it flows, and just want to be a resource to folks. And it's just been an honor to be able to partner with tribes on some of these policy challenges. So thank you.
Hello, my name is Steve Edwards, and I'm the chairman of the Swinomish tribe. I just want to share, some of the issues that our tribe experiences, and it's we have a housing crisis. crisis on our reservation, and, you know, housing is a big issue. You know, we have in all of our communities, and we've all experienced multiple families living in homes. You know, we have 2, 3-bedroom homes, and we have 2 or 3 families living there, you know, 8 to 10, 12 people sometimes. And that's really disturbing to see. And trying to help in any way we can is very difficult because, you know, we are a service tribe and we do the best we can with it. And sometimes it's just not enough. You know, we don't have a big casino. We are a fishing community. We can't provide all of the, you know, the greater services. And the cost of living in Skagit County is very high, you know. Homes are going for $500,000. Our people can't afford those homes. You know, rent is high, and to be honest with you, it's not available. And Skagit County is one of the areas where it is, we have people who live in, who work for our tribe who live outside of Skagit County. They can't even find housing in our area, and, you know, let alone our own people. So these are challenges for us at Swinomish, and, you know, what we would ask is, you know, we are appreciative of the additional funds in the biennium budget and the short-term housing vouchers, you know, for individuals suffering from substance use disorder. But, you know, the transitional housing is a must for our community. You know, the funding has to be available, you know, and even once we have these, fulfill these housing issues, you know, just staffing is another issue. You know, it's hard because, like I said, we can't get people to come and work for you, let alone live nearby, right? Without having to, you know, drive an hour each way to and from work. With, you know, and that's hard to do with gas prices today. People want to live close to wherever their job location is because, you know, it's all about affordability. Who can afford to do that? You know, these are big issues with the tribes and the state itself, to be honest with you. And I hope that in the future there's a way we could become and find different ways to partnership to make lives easier for all of us. You know, we can work together as tribes and state, federal. We could work with anybody, but, you know, we have to, we just have to learn to communicate better. And, you know, like it was said earlier, you know, use our voices. Don't be afraid to speak up for your communities. Don't be afraid to share what your needs are, because there is a big need. And, you know, we are trying to protect generations. It's not trying to protect me. I don't do this job to protect me. I do this job so that my people have a future. My kids have a future. That's what I like about this job, is trying to find solutions and finding better ways to communicate, finding better ways to build partnerships, relationships, so that, like I said, our communities have a future. And thank you for your time.
Anyone else want to speak? Hey.
appreciate that. Nate Tyler, Koch Tribal Council. Going through the presentation, there's a few things that I wish we would have talked about. Foreclosures, repos, empty houses, by area. I think that's part of the equation. There's so many empty houses nationally sitting empty. That should be part of the discussion. By area, predatory lending, that's real. You look at all these apartments being built. I mean, everywhere, and it's predatory. Taking our kids for a ride going to college, having to pay these, high leases, but yet they wouldn't qualify for a home loan. They can pay $1,800 a month for 4 years going to college, yet be denied for a home loan. There's a problem there. When we're talking housing and how important housing is, especially towards not just success, but just living. I don't know what programs are in place in Washington State, but I do remember Trump, one of the programs Trump did have. One of the programs he did put in place was opportunity zones. It wasn't perfect. The guy running it did come out to Squim and met with us. I don't know if Teresa remembers that. But they did. Yeah, the Emerald something opportunity zones. Right. But I think, putting something together like something similar for our state, would be awesome, towards philanthropy, specifically just towards housing, because it's such a need throughout Washington State. I think would be worthwhile towards looking into. I think would save a lot more money as a state, thinking outside the box. If there's 1,000 empty houses in Western Washington and the state, purchased the loans through the banks, I think would save a lot more money by doing that and turn it over to families that could actually pay the balance off. The money's there sounds like through commerce anyways, or through capital funding anyways. So just thinking outside the box, I think, is really important. And especially, like Macaw, we started, prior to the pandemic, we were purchasing houses off the reservation. So looking at all these the values of these homes in, say, 2017, and seeing some of these houses sell today, it's more than double the price. That's greed. That's not the value of the home. That is straight greed. A bank isn't going to loan me money for more than the home's worth, yet these people are selling homes for double the value. So we have, all kinds of problems when it comes to housing, just because it became more predatory than anything, I think. That's my opinion, pre-pandemic, post-pandemic, during the pandemic. The chairman from Swinomish is right. Multi-generational homes is real on each and every one of our reservations. Couch surfing, homelessness, so I really don't know what the answer is. The way we live, our government, our tribal government can't operate the same way as the federal government. That's a fact. We can't keep spending and overspending and have a debt, which is a fact. But We also subsidize quite a bit for a lot of our programs. So, you know, housing is one of them. We did purchase a number of 300 and some square foot cabins during the pandemic just to put people on our waiting list in these places. So that's at our cost, and we'll continue operating like that probably forever. You know, the days of HUD are long gone when I paid $185 max, and my house was paid off in less than 10 years, and it became mine. Today, that's unheard of. You know, with Nahasda and what we're forced to operate within throughout Nahasda is different than how we operated in, you know, the 90s up until the early 2000s when things changed. So housing's a, you know, humongous issue on every single reservation. So there's so many barriers that we face. It doesn't matter if it's Makah, Spokane, Swinomish, Tulalip, checkered bordered reservations, another issue. You know, land taken from tribes within their boundaries of the reservation, taken out of trust status. So there's so many issues that we have to remember, but you know, I think working together, you know, and finding solutions and working with commerce and moving forward, I think is important. So appreciate it.
Oh, geez, sir. Yeah, thank you for those comments, and a riff on a couple of them. You know, the strategy of purchasing housing, I think, is really a key part of, I mean, it's something that's been going on for a long time, but, you know, to the extent that houses are purchased by, you know, a tribe or a nonprofit or housing authority, et cetera, they're not subject to this speculation. Because the thing is, you see $1 million houses, average prices in Seattle, those are very affordable to people in that market. So that's so to the extent that you're like, to the extent you purchase the house, as you're saying, like 5-10 years ago, it's not subject to that market speculation where all of a sudden its price just goes through the roof because someone shows up with enough money to purchase it. I think, you know, along the lines of what you're saying too, the predatory behavior, there's been a lot of work in the last few years of the legislative session around landlord-tenant law, and I'm guessing it'll evolve some more. Like, what's the right balance between, you know, honoring the rights of the property owner to do what they need to do to have a successful landlord experience where they, you know, incentivize them to build apartments, et cetera, and like protect predatory behavior. So striking that balance, what the right set of laws are, and sort of separate from and related to that is just predatory and price gouging behavior. There's been consideration of laws to prevent price gouging. You know, in a situation where there's nothing available, all of a sudden the market's so tight that the market power goes to the landholder, and they can propose prices. It's like water, you know, in a famine or in a desert. Like, all of a sudden it becomes very valuable, right? So we need to work on the market to the extent that get the market to build more houses, and you saw some of that in the last legislative session where they eased off some of the regulations to make it easier to build more housing in the market solution, and pulling some of that housing aside from the market so it's not subject to that speculation. So it's not when there's a surge of incomes and people are able to move into an area and affordably purchase houses for $1 million in a community that is on a different trajectory historically and is not able to sort of do well in that environment.
Good afternoon. Good afternoon. I think it's working. Can you hear me okay? Okay. Oh, closer. Thank you, Ted, for this, and Chairwoman. Umair Shah, Secretary of Health for the great state of Washington. I wanted to ask a question maybe of the two of you or to others in the audience. Both of you talked about the vulnerability that occurs when someone is transitioning from a care setting into a community setting, or from one home to another home, or from one activity to another activity. There seems to be some particular vulnerability right there. There's vulnerability throughout. There's vulnerability in stable housing, there's vulnerability in the care setting, but that intersect where there seems to be incredible need for wraparound services and attention to that work, whether it's community health workers, whether it's peer counselors, and I'm just thinking more in terms of opioids, fentanyl, and other kinds of activities that we're obviously all here for. I wondered if you could talk more about what kinds of services, or maybe again, audience, what kinds of services that you all see are in need, and what can we as a state do to try to shore up those services or those wraparound activities as people are particularly transitioning in between somewhere to somewhere else, and things are not as stable. So I hope that makes sense. I'm trying to just understand and underscore some of the needs that are in that transition space, which I think can also help us as we think about how we can help serve those needs. Thank you.
So I think I'll start, and then hopefully others will add. I think what's really important with Native Americans is that wherever they're coming from, especially when they're vulnerable, if they're coming from a place where they have received services for addiction and they're moving somewhere else, they almost need a plan. It's like they need someone there that's helping them identify where do they need to go to be successful, to continue on, because where they're going, most likely, they're not going to be able to just go there and then all of a sudden they're normal. They're going to be able to go get a job because they're going to have to continue with the services they need, whether it's for mental health or for addiction counseling. They need to get in those groups, so then eventually they'll need to get a job. So that kind of, depends on where they're coming from and where they're going and what services they still need, because some of them may not have driver's license, they may not have GEDs or diplomas, and they need those services that will help them grow so that they eventually can go out on their own. And it may take a long time. It may take, if I've been in addiction since, let's say, 14 years old, and I'm now 29. I've been there a long time. It's going to take me some time for healing. And if I'm finally starting to recover and I'm coming out of inpatient to somewhere outpatient, and depending on me, if I go to an Oxford home or transitional housing back to my own tribe, I need those services. I need to know that someone cares for me. I think that was talked about this morning. So that people need to know that we care. And I think for Native American people, that's what we're about. That's where we came from. We were a people that survived in a beautiful way. We cared for one another. We cared for our environment. We cared for the water, air, and everything around us, and we took care of it. And so when you get into addiction, you lose sight of that, and you lose some of those values. So you need to be loved again and be brought back to where you can start feeling good about yourself.
That plan is not a short-term plan. I mean, you can say 3 months, and that's not so. you could say 2 years, and that may not be so for some people because they haven't gotten their strength yet. So with family and their navigators and their connections, it is a lifetime plan for them.
Hi, I'm Marnita Parr. I'm the interim executive director with the Spokane Indian Housing Authority. I would like to just request that information be brought back to whoever's working on this crisis for all of the plans that we are seeing here in these next couple of days. When we have family members that are going off the reservation or even within a reservation and they get hooked on these, they find people that they can rely on, who they benefit from, who they trust. And when they decide to get sober or straight or kick the habit, they like to bring those people with them wherever they go, and sometimes those people with them are not tribal members. So when you're moving them back on a reservation and they're not tribal members or even non-tribal members, you're opening up the whole other issue of maybe other factors that'll come in later down the road, having law enforcement called in or something like that. When our tribal police cannot deal with those situations because it's a non-tribal member, some funding somewhere is going to have to come from there, or some corresponding or some agreements between law enforcement and the tribes to be able to deal with this. And then if they're in our housing units, if things end up turning bad, then that ultimately results in that family not complying with their lease, which leaves them homeless again. So you don't want them to just go around and around. You have to realize that we're going to need some sort of agreements in, working with your counties, if it's your county police or if you're your sheriff, working with your tribal police, and sometimes that doesn't happen. Sometimes you can live where I live, way far away, out of the normal, and those departments don't always want to come and help you. So those people coming on the reservation that are not your tribal members learn that. So even like I heard of the cartel going up in I-5, even if they come out and they learn that nothing's going to happen to them on the reservation, they end up being your predators. They're looking for your tribal members that need somebody to be trusted. So they worm their way in there, and they know that they can't, nothing will happen to them on a reservation. So that needs to be kind of brought up in the discussion with all of this somehow. If it's not funding for the tribes to hire people that are to deal with non-tribal members, or if it's funding that goes straight to the county for more sheriffs that are to be directly servicing tribes that are close to them. It needs to be brought up, because sooner or later they are going to get smart enough to realize that all they have to do is go find my brother or my sister and say, okay, well, you could start trusting me, and move on to the reservation and learn more and cause more havoc.
So I just wanted to add an additional comment to what Marnita just explained. So on our reservation, in our constitution, we have what we call a reserved powers. So the reserved powers are things that the tribal council have to bring to the membership. And one of those reserved power is giving up any civil or criminal jurisdiction. So if non-Indians are coming and living on the reservation and our police can't arrest them, then it becomes a huge problem, because in order to even get, say, a county police to come on, we need some type of agreement, like she's saying. But what we have to do is go to our members and get approval to do those agreements with those county departments, but the members have to approve it first. So it does cause a huge issue with predators or ones coming on the reservation, and with providing the peace and safety for the people when we have those type of people that are there to harm others. It's a big problem for our reservation. We have about 159,000 acres, so it's rural, and there's a lot of places to hide that people can just go in and live there, and we could have some unsafe situations occurring.
Is it okay if I add something? I know I'm not supposed to be participating as an audience member, but in the Justice Breakout, I think they're talking about that too, so you might want to hit that one next. Any other comments?
I think one of the barriers is actually Oxford homes, you know, and getting back to your question, you know, for us on the peninsula, it's tough enough getting guys into treatment. You know, the wait could be 30 days or longer, and by that time you lose them. But you do get that special case where they do go to treatment, and when they get out, there's an expectation that they should be going to an Oxford home or a recovery home or a transitional house. That's even tougher to get into because they're always filled. You know, we did put 2 transitional homes on our reservation, one for females, one for males. So we are trying to offer them programs, but on the outside, that's, you know, still a humongous barrier for all our tribal members. Not just Macaws, but I'd imagine anybody on the peninsula, because there's only so many Oxford homes in Port Angeles. And then you're talking Olympia, Yakima. We're sending people to treatment far down south, Yakima, the native one down in down south, forget the name of it, Northwest Treatment Facility. So, I mean, it's tough. It's tough just to get into treatment. It's tough to get accepted because they don't, unless we pay hard dollars. We can send them anywhere. But if we're not paying hard dollars, then it's slim pickings to, you know, find a treatment facility that's going to actually treat the disease. And then once they finish, it's even harder to get them wraparound services.
Good afternoon, everybody. Can you hear me? I'm Scott Russell. I work with Department of Corrections in the Reentry Division, and privileged to be here and very thought-provoking. A couple of things that come to mind for me is my fear is we may be competing for transitional housing through our state agencies, with similar to the Oxford House and such. And so for folks that are justice involved, that are also looking for housing, this might be an opportunity for us to share that we may be competing for a very limited resource. There are protections with our voucher programs, but not all of them. So we do have to have approved addresses for certain individuals that do create potential risk and may be predatory. But then there are other aspects of our voucher programs where folks are eligible without an approved address. And so we are keeping folks past their earned release date because we are unable to provide housing for them, as well as treatment beds are very limited. So certainly appreciate that perspective. What we're also trying to do is partner with other state agencies. As shared today, the Governor's Executive Order 1605 gives us, I believe, additional opportunity to maybe enhance that, working with other state agencies. Those that are justice involved, we have challenges with regards to driver's license, state ID, social security number with the feds. And so those are things we're trying to work through to try to get folks prepared so that the last thing they have to worry about is those basic needs when they release, but unfortunately we're not there yet. So just wanted to share that. And Dr. Shaw, we have variety of committees for assessing risk, for dangerously mentally ill or seriously mentally ill. And it's a community safety committee through our health services division that attempt to try to figure out how to do wraparound services that you're talking about. And our navigators that Secretary Strange was talking about today are those that are in reentry centers as well as graduated reentry, which is electronic home monitoring. So those navigators helping those in partial confinement, but we have so many, as she shared, that release directly from prison that we just don't have those resources yet. So, thank you.
Thank you. I'm Terry Goban, Tribal Chairwoman. One of the things you were talking about, the treatment facilities, the Thunderbird House just purchased that property on Vashon Island that they're going to be opening that with, I believe it's over 80 beds, and they will also be able to take in some pregnant women. They'll be able to even house them. So it's going to be, but it's going to be a culturally relevant facility. So that's one good thing. But hearing everybody talk about these, every single piece is needed. Every single bit of housing. I mean, we opened up the 20 pallet shelters just for that. And those are just small, I mean, you can fit 2 people in there. And these ones are for low barrier for those that are still using. And then you work on them there with the counselors and try to get them into treatment into your MAP facility. And then from there, transitional home. And then from there, so we got only like 6 of the transitional homes, but everything's packed right now. I mean, we just keep on adding on and then everything fills up. We just opened up, I think it was 19 cottages, which are 2-bedroom units, and they filled up. We're in the process of doing apartments for 87 units from 1 to 3 bedrooms. But, and then still doing houses. The issue in our area is the cost of houses, and every time we see one that we've been watching for ones to buy to have the, to have the group homes there, the Oxford House. And so we've been watching for those to pick up those kind of deals, but it's just, you need every single bit to try to, it's like a stepping stone until they get home ownership. And then we're also trying to build some, I think 30 nice, they're nicer houses. But to be a member of our tribe residency is a requirement for at least 1 year prior to the birth of your child. And so for those who can't, I mean, we never had housing on the reservation. Back when I was young, there wasn't much. And I have one granddaughter who moved into our upstairs and getting her residency, and then I was really excited. My other granddaughter just contacted us, and she wants to come in, but she just finished getting her physician's assistant, she's graduating from the UW, and she wants to go into behavioral health. I was so happy. I said, we'll find you someplace to stay. Don't worry. You're coming over. So she wants to go back to work for our tribe. But every little piece is needed. And, you try to save every life, and it's exhausting. And for us leaders they expect us to be at every funeral, and to see these young ones. And we can talk about it, but it's the little ones who suffer. And then the trauma that they go through is really what's, really tough. But every single piece is needed, and we're being outpriced in houses in our area too. So it's, if you're not building your own, it's going to be hard to get people to buy houses.
Hello, Ruben Twin here again. I've been a substance use disorder professional for the last 22 years. In the last 22 years, I got to work with the tribes out here. I'm from Pine Ridge, South Dakota, and so I'm a guest out here in the Northwest. And one of the things that I look at when we talk about opioids, when we talk about substance use disorders, and we talk about, how does this impact our people, one of the things over the last 22 years that I've always looked at was wraparound services, but culturally appropriate services. And what does culturally appropriate services look like? And that falls under the DSM-5, the Diagnostic Systematic Mental Health Disorders, and the criteria that is in the DSM-5. And then you got ASAM, and ASAM determines the level of care. And so working with drug court, and talking to drug court, I have a really good friend who retired from near Tom Essex, who was part of drug court in Seattle. And when I worked with the college tribe, advocating for our people. Now, I'm a sun dancer. I come from South Dakota. But being a guest out here, learning the big house, the long house, the smokehouse, the CON ways, and understanding the importance of that, understanding the importance of the canoe journey as a substance use disorder professional and advocating with the courts and working with the courts, and that's communication with the courts. It's the language that we have to learn to utilize with the system, and getting them to understand that these are culturally appropriate services, but because they do not meet best practices, are not recognized because it does not fall under billable insurances. And so because they're back to that funding piece. But when I worked with the courts, I got individuals that were allowed to go to smokehouse for 3 months in lieu of inpatient treatment. The courts allowed that. And that's using best practices, but it's not appropriate by ASAM, it's not appropriate by DSM-5, it's not appropriate by the insurance companies. But the court says we'll give you that opportunity to allow those tribal members to go to the smokehouse. They are still clean and sober to this day. An individual also with another court system advocating said, in lieu of inpatient treatment, how about we try the canoe journey? You got housing, you got food, you got wraparound services. You actually get to participate in your culture. That person is still clean and sober today. That court actually took the risk on that individual, but that's as a provider taking those risks and advocating on behalf of our tribal members. But you have to be a tribal member to understand the importance of that. That's one of the barriers that we have within our treatment services, that we have non-tribal members within our programs that don't understand the importance of our culture because it does not fall into best practices. And so when they do get clean and sober and they do get into long-term recovery and they are into recovery and they want to go into housing, now it becomes this next process of financial management, financial education, financial literacy. We got individuals that sometimes can get funds and then they do get their housing, and next thing you know, they don't know about the condo association that they have to pay for. They don't understand the rules that this is my home, so I can't allow my own family members to come in here because we take care of our family, and so family comes in. But then again, the condo association says you can't do that. Or also because we're Indian country, we understand that we can have a couple cars on our house. Also, it's like, no, you can't park that car there because, well, that car belongs to somebody. Well, you can't park it there because that's taking up somebody else's space and it's actually not, doesn't make sure our property looks good. So having them understand that education that comes with that is really crucial in that treatment services that says you are going from one type of living to another type of living. You have to have that financial literacy that understands what a credit score means. We make a joke and sometimes we crack up that says, our kids already have credit scores and they have credits because their parents use their name to get credit cards because they're getting, and we laugh about that, but that is the truth. We're using kids, grandkids to get credit cards so we can actually maintain some type of living. And their credit is already messed up before they even able to get a job and have credit. And that goes on their thing. At the same time, also speaking to domestic violence. Also, when you ask to leave a home in an emergency, now all of a sudden you're part of that lease, you're part of that rental agreement, and all of a sudden now the person staying there damages your property and gets an eviction. Now you have an eviction on your record. How do you get that taken care of? Now that follows you. Now you can't get into another property. And so there is a lot of barriers to our people that most people don't see because they're invisible. You have to be in our people. So the one thing that I push for is continuing to have people understand best practices and having cultural appropriate care is identified as best practices. And that has to happen at the state. But financial literacy, this all ties into housing because they can succeed and they do succeed with types of care, but we have to think outside the box. And we have to look at the housing outside the box. And so there's all this kind of stuff, as we said, as a researcher, it's all connected. I've worked in the substance use field for 22 years, and there's one thing that I can always tell people that I continue to push for. If we can get ahead of it, we need mental health housing. Because if you get clean and sober, you still have mental health issues. You still have PTSD. You still have grief and loss. You still have anxiety. You still have bipolarism. You still have these disorders. And if they're not checked and if they're not put in balance, you're going to lose your housing. So we need to start looking at that and making sure that there's mental health. Because we got recovery house, we got sobriety housing, domestic violence, family, individual, but we don't got mental health. And those individuals do need that because they will go back to substances. They will get kicked out of their housing because nobody's addressing mental health and mental health recovery housing. And that's just something that I like to advocate for is mental health housing. That's just my piece right there. And thank you again for my time.
Yes, so we have 6 minutes left, but we want your input, so if you have something to say, we really want you to speak up.
Thank you. So my name is Tony Bowie. I am the Assistant Secretary for Economic Services, and so Dr. Shaw, one of the questions that was asked is what is needed as individuals transition. And so for us, one of the things we know is big is that, that financial support, that the ability to purchase food and have medical. And so that's one of the things that Economic Services provides. We also know that we have several tribes that are running their TANF programs. We're also looking to expand that for the SNAP programs. And so, and if there are opportunities for individuals with either temporary housing, we are more than happy to come out because we have a mobile CSO that we can send those CSOs out. But we also have staff that can come out independently to make sure that individuals can sign up for their programs, so make sure that they're eligible. But one of the things I wanted to ask Ted is, so we have the Division of Child Support as well. And so every 4 years, we get a subgroup together, and this subgroup takes a look at the current policies around child support. And then they identify policies they want to change and make recommendations. And so when we talk about the housing programs and how stringent they are with the rules, I wonder if that happens. And again, I'm not as familiar with the housing program, so just curious if there is a every 4 years, every couple years that we take a look at those rules around housing to determine whether or not we need to start making recommendations on changes so that because our environment changes, right? Times have changed. Our communities have changed and needs have changed. So just curious. Thank you.
Yeah, no, absolutely. It's critical. You know, planning, data-driven planning, research-driven planning. We have always have a number of research projects out there to test our ideas to see if what we're doing actually works the way we thought it would work. And then that's tied to strategic planning. That was paused through the pandemic, but we're just beginning the procurement process and the planning process to get a new round of that started. So we have, I you know, reread it the other day. I feel like our strategic plan from 2019 makes a lot of sense, but boy, the world's different, isn't it, in so many ways. So yes, it's critical to revisit all of those things regularly. I mean, more than but prior to the pandemic, we basically at least amended our strategic plan every year. We have not done that in three years now, so it is time, and so this session will help feed that and then the learnings that come from it. You know, one of the things I was thinking about the follow-up care question, and that's really critical, that transition point that Dr. Shaw mentioned. You know, I think we're on a path with, it's not the whole solution, but foundational community supports with the Healthcare Authority that uses Medicaid money to bring services tied to the housing, so that housing money doesn't pay for housing, but you know, what are the services needed? And in the idealized model, it's not just necessarily even associated with the housing, it's associated with the person, right? So as they're in one setting and they go to another setting, they get that same service, but you know, the same provider in idealized sense of the word. You know, and back to one of the things that I've lost a lot of sleep over the years over on different things, and one of them was, you know, years ago, we were monitoring this program. We have this program we work in partnership with DSHS with, where they determine, using this rigorous, kind of hard to get through process, medical evidence, that a person isn't able to work and doesn't have any resources, and therefore they're eligible for rent assistance. It's called housing and essential needs. The way that program is structured in the law is that it's structured first for people who are homeless, and there's a specific definition of that, and then secondarily for people at risk of homelessness. In a monitoring situation years ago, we found that this treatment provider, doing a good thing as far as I'm concerned, was getting their people, while they're in treatment, enrolled in housing and essential needs, and then when they discharged, enrolling them in the housing essential needs program so we could pay their rent. The problem was they weren't actually homeless, and technically they were eligible, but in the community as a whole, they weren't fulfilling the law, which says to prioritize homelessness. And we said, hey, you can't do that. You need to address the people living outside, and if you still have money left, which they didn't, then you can theoretically. And they're like, but wait, these people were housed, but when they went through treatment, and they have a place to go, but it's a place where, living with people who are still using. And so they don't, by any definition, meet the definition of homeless. And then we were basically shutting down that completely logical pathway of getting people away from that situation. So when they exited treatment, they could get a fresh start. And the Department of Commerce said, because we're, again, faced with this, not only the law, but even just generally, we do have to make this choice. Like, is there a person outside or the person who's inside but could potentially relapse because it's a less than ideal housing situation? So that, it's just always the struggle. What does that transition look like? How does it get paid for? Who do we prioritize? And it's not an easy question to answer.
Hissahalt Petsia. Good afternoon, my friends and relatives. Tsamasat Luhis Quest. Tsamasas my Spokane name, my Indian name given to me by my late grandmother Cecilia Pion Abrahamson. So how many in here, this is your first time being in the housing breakout session? So we have 1, 2, 3, 4. Are all new and the others were here in the first? So the way it's designed is we're doing the same thing twice, is that correct?
It seems like also that the purpose of this second is to, in the first session, we focused more on the areas of concern of the community, and in the second one, perhaps just more formulated and tribal and state partnership.
Okay. Like I said, my name is Carol Evans. I'm the chairwoman of the Spokane Tribe of Indians, and really honored to be here with you today to talk about opioid and fentanyl disorders as it relates to housing and homelessness. So in our first session, we had a lot of talk about housing, homelessness, and opioid disorders and the impact on us. And so we had identified a lot of the things, the needs that we have. And so I think this session we are going to focus more on what we need to do going forward. So I'll just give you a little bit of background about my involvement with housing. So on our reservation, we have the traditional HUD housing model. So we have a tribally designated housing entity that has a lot of rules, and it doesn't actually serve the whole population of the reservation, and it definitely is not conducive to people who are in recovery, because a lot of times the people in recovery have been permanently evicted, are not allowed back in the units. And so in the first session, we talked about the needs for having things like transitional housing, having Oxford House opportunities, having care centers, having wraparound services for people coming out of outpatient and coming back to live on the reservation or transition back to their homes. And so not a lot of the tribes have access to transitional housing or Oxford homes or care facilities to help their people transition back after going to treatment. And so as we move on talking about what are some of the solutions moving forward, so I think we want to find ways to build housing that is set aside for those type of needs. And some of the tribes have worked on things like building tribal houses for people that don't qualify for the traditional housing units, or building housing that are set aside for people that are single, that aren't able to go into the housing units from that are built with HUD housing, the traditional HUD housing, or building tiny homes for some of the people in transition situations. And at the same time to provide wraparound services for all of their needs as they come home. So including providing those individuals with transportation to services, mental health counseling, drug addiction counseling, training to actually go back in the workforce. So those are some of the things we talked about in our earlier session. So I think did we just want to open it up, or should I go ahead and have Ted have some remarks also? Ted? I really cut mine down.
Good afternoon. I could do the presentation again, but maybe I'll just say some words. So I'm Ted Kelleher. I am the Housing Policy Director, Washington State Department of Commerce. In Washington State, the Department of Commerce is the state agency charged with housing. The largest player in housing in the United States and in Washington is the federal government, primarily through housing and urban development. But the state does have a role. It has its own funding that goes to communities. We both capital funding to to construct housing, and then operating funding to operate it, typically including like leasing buildings, providing the staffing needed, et cetera. The federal money, and I don't want to disparage the federal money. I guess to be fair to the federal money, they kind of have a strong vision of what should happen, and with that comes a lot of rules because they want to make their vision happen with a lot of rules. The state historically, and the Department of Commerce in general in particular, has a more community-focused approach in that we're providing, in many cases, just formula money or what's your good idea and we'll fund it. So one thing that can get confusing in a housing conversation is that people will have concerns about the frictions and contradictions and narrowness of the federal funding, but that doesn't apply to the state funding. So one of my goals here today, and that's following on something the agency's been doing, is how do we get the state money that's out there that's more flexible and get it, not adequate, but more flexible at least, and get it to tribes in particular in a way that's more fair. Because the way it flows on the operating side is it goes from the state to county governments, and then county governments contracted out sometimes to tribes, usually not, usually to nonprofit organizations. And then for the capital money that you use to purchase things, it goes from the state in a very, very competitive process where we could spend 3-4 times as much, and it goes to nonprofits, housing authorities, and in some instances, tribes. So that process is, competitive, but doesn't feel particularly fair. So during the pandemic, one of the things we experimented with is setting aside money for tribes using some of the COVID housing money we had. We just set aside, admittedly arbitrary percentages, but just to practice, well, what does it look like to allocate money directly to a tribe and build that relationship, build that capacity back and forth. Capacity is sort of we were worried about capacity, but frankly, our interactions with the tribes were very capable, because they had to deal with the federal government for so long that to the extent, oh yeah, we can deal with your commerce and your so that was part of our learning with that. And so coming out of the pandemic, the legislature put actually into law a specific set aside, for instance, that 20% of the capital funding, the money used to build buildings, acquire land, has to go to historically organizations governed by and serving historically marginalized people, and tribes fits in that group. You know, as a sovereign nations, it's you know, not a perfect fit, but that 20% is part of what we're building on. During the rush of the pandemic, we just put the money out there, and we knew that it wasn't going to go perfectly because we hadn't had the time to build the relationships, to build the capacity. Now that we're exiting the pandemic, we're standing up, and if you know someone who would be good at this job, we've got a whole org chart full of empty boxes, a technical assistance arm. So as opposed to right now we put out the application as sort of like, well, whoever puts in the best application gets the money. We're trying to really provide technical assistance so organizations who historically haven't gotten that money, don't have that experience, don't know how to access that. We're going to, you know, proactively, and we have some ideas about what that technical assistance looks like, you know, both at different levels. I mean, like classes and materials, and individual people will just come into your community and sit there and work with you. But we really need to learn more about how to do that well, because we have some hopefully bright ideas, but like, you know, I've been here before, and our bright ideas probably aren't so bright until we really, so help us. Part of my goal here today is to begin to learn more, and to begin those relationships to really deliver, because you know, it's not okay for us to just, okay, well, we did some seminars about how to fill out this application, we're done with our responsibility. No, we really need to deliver. We really need to get the money out there in a way that feels more equitable, more fair. I don't know what that looks like exactly. That's actually a conversation if you have ideas about what fair looks. I mean, we've been in this conversation a lot at the state level, and you know, there's some numeric numbers, and there's some that you could potentially measure. Those are imperfect. There's just the people having a legitimate feeling that they've been heard, and that they understand how the money works, and that they've had a reasonable chance to get at it. So that's one of our big goals that we'll be marching forward on. Again, building off our experience that the agency and the governor just did without any direction during the pandemic, and then the legislature following and saying, we really like that. In fact, we liked it so much we're going to put it into law that you do that more deliberatively. One of the dynamics I think we're going to crash into, unfortunately, with even though we're doing this better reach out, is just the shortage of resource for housing. So we end up, you know, we get into these conversations where organizations are pitted against each other because it's a zero-sum game and there's not enough to go around. So there's different ways of measuring it, but in broad strokes, a conservative way of looking at it is for every 2 people that we have outside right now, we're only able to bring 1 inside based on the number of beds we have. And so we get into these horrible situations at the state and the community levels. Like, who do you decide out of those 2 people to bring inside tonight? And the governor pushed hard in the last session, you know, go big so people can go home or come home, I forget the exact slogan. Anyway, he asked for $4 billion, and in the last legislative session there was a significant increase in investment. But like any political process, you don't usually get everything you ask for, so it wasn't $4 billion, but there is more resource out there. So there's 2 things that are going to happen. We're going to push to get it out there more equitably. There'll be more of it, which makes that conversation less pitting people against each other, and it's still going to feel like not enough. So when I was speaking to, there's only enough slots to bring 1 out of every 2 people inside. Another lens is for affordable housing. For every 4 people who are eligible for affordable housing, meaning they have a low income and they're paying a lot, more than 50% of their income, for instance, for rent, we're only able to serve 1. So only 1 out of 4 we serve. When you think about similar programs like food assistance, in food assistance, if you reach the eligibility criteria, now you can argue whether it's the right eligibility criteria. You can argue about whether the food assistance is enough, but if you reach that criteria, you get food assistance. Same with Medicaid. If you meet the criteria for Medicaid or subsidy through the Affordable Care Act marketplaces, Obamacare, you get that subsidy. You can, whether it's right or the right amount is a different question. When it comes to housing, that's not true. So we end up in this these triage conversations, and the triage plays out any number of ways. It can play out passively, where, oh, the first person who comes through the door gets the money, or we'll create a waiting list, or it can be a more active process where you do like a scored assessment and whoever's most at risk by whatever criteria. But at the end of the day, the system right now is having to make choices. It's saying, and this is a real choice I talked about in the last session. There's a person living outside. Should we serve them, or should we serve the person coming out of treatment who doesn't have, if they go back to they're not homeless, but if they go back to the place they lived before, it's with people who are still using. State, make a choice, and it's like, that's not a good choice. But that's where we're at in terms of choices. And I think, housing, this is the housing session we're in, and housing, I don't want to overly narrow it, but there is an important kind of technical consideration. Housing is either, in the way it's funded and the way that word is used in this state, is a place that you have a lease, like you have an apartment or a mortgage. That's housing, right? You have tenancy rights. People can't just walk in your door. If you have an apartment, they have to give you notice, and it's your home. All sorts of legalisms around that. Or we also fund emergency housing, which is like a temporary shelter type situation, or transitional housing, which doesn't have rights of tenancy, but isn't treatment. Because there's another, and that's one of the confusions, there's a blurry line, right? And there's transitions between it, but there's like a clinical treatment facility would be, it's a licensed facility. There's, licensed professionals work there. It's very, it's regulated from a healthcare perspective. So in any way you look at it, we need a system of places for people to be. Right now we've got a lot of people outside. We've got a lot of people doubled up, tripled up, in both places suffering with substance use disorder, fentanyl in particular, opioid use disorder generally, and other substance use problems. And we just don't have enough places to put them. I mean, based on your politics and values, you might have different ideas of where people can go. Some people are arguing for significantly more involuntary placements, like either psychiatric placements. The classic involuntary placement is jail or prison. There's housing, there's shelter. If you take out all those systems and add them together, we don't have enough places. Any way you do the math, whatever your politics are, we don't have enough places. So there's sort of two things on the table. Having enough places, and then deciding what those places, what the tactics are connected to that. What are the services? Is it a place where on one extreme where you have a lease and you have rights of tenancy, and at the other extreme where you're committed against your will? In either place, the costs, if you kind of squint, are actually not radically different. It's just we need more places, and then we need to talk about how to get people into those places and how to transition them between the places. We can just go right into questions, right? Oh. I think we can get the microphone.
Because we thought we were doing two listening things.
We have those 4 questions.
Oh, okay.
These ones here. This morning we kind of focused on that one.
Do you want to go over them?
Yeah. So this morning I brought out the 4 things we needed to consider in the session, and so I want to go through those and then open it up. So the first thing we were asked to do is to identify tribal areas of concern and change that can happen with current powers in our government's cabinet system. So in the earlier session, we spent quite a bit of time. Most of our time was on this item. And the second item we're asked to do is to begin to formulate what a tribal state partnership to combat the opioid fentanyl crisis looks like. The third area we're asked to look at is identify areas where legislative intervention is needed because it falls outside of the purview of government and the secretaries, of the governor and the secretaries. And the fourth thing we're asked to do is to create recommendations for institutional and systemic change that is to be brought directly to the governor for the day 2 of the work session. So I just wanted to read those again for this session. And so we'll go ahead and open it up for input from the group and any questions.
Hi, Carol. And Ted, right? Yes. Hi, I'm Charlene Abrahamson. I'm the Director of Family Services for the Squaxin Island Tribe, also a proud Spokane tribal member, living on this side for a while. Thank you for reading those, Chairwoman Evans. Sounds like you heard enough on concerns. I know as I was listening, I definitely heard a lot of potential obstacles between sovereignty and getting the money and any conditions around the money and tenancy and things like that. So I think a lot of the recommendations that I would think of and legislatively is that we have support and fixes from the legislature that allow Department of Commerce and other state agencies to understand that sovereignty and where certain things would apply and conditions and certain things don't apply, but we would still be reaching the same goals, I believe, for getting some housing stability and housing for either houseless or SUD. And that is going to be hard to decide, like you said, coming out of treatment or getting stability there. I know my preference is, but I guess that would be my first recommendation is in 3 and 4, the legislative intervention that allows for that. And then I think when we have that captured legislatively, it also prompts different staff to ensure that they understand the basis behind that. So I think on partnership-wise, we both have a lot of experience, as you were mentioning, working with the federal governments and just understanding that sovereignty piece as we start to look at different housing and that it won't necessarily look the same as something in the middle of Olympia or Spokane or that type of thing. Hope that makes sense. Thank you.
Thank you, 100%. And that's, one of the things we learned through the pandemic was, we can't just send our normal contract template. And so that was on us that we didn't know that. So we know a little bit more, and hopefully, I think that's an important thread to pursue. The sovereign status is not the same relationship that we have with other entities.
Just to, I'm sure that you do as an agency have a consultation policy, but that could be a good first step is to whatever your consultation policy is with tribes to ensure that we start there and start getting the word out in listening sessions and that type of thing. Looking at past kind of missteps as we partnered together, not Department of Commerce, but is hearing about listening sessions far after the fact and as things have been enacted that would be different for tribes. And do you have a consultation policy? I guess I should ask that.
Do we formally have a consultation policy at this point? It's unclear to me.
That's a big question. I can usually yell, but I will grab this. That's a really good question. I'm Michelle Gladstone-Wade. I serve as the liaison for the Department of Commerce. And we are actively working to bring a draft of an updated tribal relations policy to the tribal chairman and chairwoman at our next ComTAC gathering, which will be hosted by the Kalispell at Northern Quest in June. The expanded policy does include 3 or 4 different versions of tribal engagement, how commerce can engage with tribes based on the topic, who is included in the conversation and the request of the tribe, which will be fully fleshed out with internal education for our staff who may not have had a lot of interaction with tribal folks, And we'll also be working on a data sovereignty policy for commerce, and we were just having a side conversation here about contracting, which did come up in a previous question, where we're hoping to move towards more of a government-to-government agreement model as opposed to separate program-by-program contracts. Commerce has over 120 programs, and it just seems absurd for that many individual contracts to be going out to the individual tribes. The barrier that I have right now is staff. I would have to get a contracting specialist in our contracts area to handle that many government-to-government agreements. But it's on my very long list of things to do. I did just bring on a deputy to help expand Tribal at Commerce so that we can respond more quickly to these kinds of questions. I joke that getting Commerce to do anything like turning the Titanic in a mud puddle. And so now I got two people to get that Titanic turning. So the discussion will start with tribal leadership in June, and I'm sure we'll go into many specific one-on-one conversations between tribal leadership and commerce leadership. And as those policies roll out and become solidified, we'll start directing internal changes within commerce.
This is really apples to apples comparison. Oh, yes, I apologize and forget about people online. But many tribes, including Squaxin Island, we made use of the ERAP, Emergency Rental Assistance Program, through the Treasury, and went through over $1 million to distribute for rental assistance, which was a big, it's fun, I think, if somebody gave me $1 million, it's like, sure, I'll spend it, but trying to get that out there. But I really found that the Treasury developed a lot of things that made it easier to do and made it easier to distribute those funds. So, like I said, it's not an exact comparison, but they did have specialized tribal portions of that were very useful.
Myself and my new deputy, are working to have tribal-specific, and I apologize for the term, but template contracts that aren't just specific to the tribe-state relationship, but also specific to our divisions. I'm being very loud and obnoxious at the executive table saying, take out the term limited waiver of sovereignty in all tribal documents. And so we are just, I'm going to be honest, we're slow. We're a state agency. I'm getting there. I'm getting there, but I have been working with my sibling agencies. Tim Collins over at DSHS has been wonderful in sharing his best practices that we can replicate over at Commerce as you kind of shove a square peg into a round hole. But I am also working with WashDOT because Megan has done some great work over there, and I figure why recreate the wheel? If we have some agencies that are doing good work, let's share practices. Let's get all of our ducks in a row and just start getting resources into tribal communities.
So I'm going to raise my hand and call on myself. Sorry. Vicki Lowe, Executive Director of the American Indian Health Commission. I'm Jamestown S'Klallam, Bella Coola First Nations from Canada. I've got like 5 things. Sorry. 1, uniform consultation policy. We're working on a uniform consultation policy. It's not fair to tribal leaders that they have to be under a different policy for each agency. So that's some work that's happening. Hopefully, when we have the Governor's Indian Health Advisory Council, I think that's the first thing on my list for agenda items. Indian Nations Agreement has, Aaron shared with you the Indian Nations Agreement that we developed with the Healthcare Authority. Indian Nations Agreement, data, you got the data. Darn, I might have to come back to myself. I should write those down. Okay. Yeah, talk about that to the people who might not know.
Right, so Aaron Spark, Office of Tribal Affairs Administrator at the Healthcare Authority. So we did come up with, I say we, I didn't do it. Vicki did that with Jesse before I got there, but Indian Nation agreements are a contract template that we have with the tribes that were agreed upon through consultation. to make sure that we had all the correct elements and agreed upon by the tribes to say that this could be a baseline for how we're going to deliver dollars, most of it from the grant world, into the tribal, into all the different tribes in the state of Washington. With that, never having to waive tribal sovereignty or anything like that throughout the contract. So we wouldn't have to go back and forth with our contracts departments, which was a very big deal. And it has made things easier. At the same time, there's a lot of complications that go in. If we have different types of money that are limited, that are very small, can we put it in as a contract addendum? What does that mean for your contracting department? But at least it gives you a baseline to work with. So I mean, that's one of the areas where I think that we can talk to all of our different sister agencies to say that there is the ability to do this, to take out the troublesome language that you may have had that you are going to run into problems with, such as, am I implying that you have to waive tribal sovereignty to get dollars? That answer should always be no, no matter what you're doing with these dollars that you have, although it does come in almost as a template with everybody else that you're working with. So it is something that can happen, but again, that does have to happen through consultation. It's a process, it's a long one, you can't just adopt it. So there is a government-to-government aspect that will create it and deliver it, but it's absolutely worth it. It's something that we'll absolutely share with you as well. There's no secret to it, it's all there. And if you don't have to go through the pains of going through the full consultation for over a year to kind of get these things done, you're gonna have to do that anyways once you get to the tribal piece, because they're not gonna like all of that, and there are gonna have to be specific pieces for the tribe that you're working with, but at least you have the template to work with.
So asking tribes to waive any of their sovereign immunity is erosion of the federal trust responsibility, so it kind of puts the state in a bad place in between them and the tribes and the federal government. So those are words we like to use. You can use them if you want. And then the county funds that you talked about, and we talked about it in the last session, that there are funds that go from the state to the county and then maybe don't go to the tribes, but they should be going to the tribes. So is there a way to pull those funds back and redirect them into these contracts you're talking about, rather than having us try and figure out how to get them out of the counties, where sometimes there aren't good relationships between the tribes and the counties? I know that Chairman Edwards from the Swinomish tribe was talking about how they had water rights issues and getting money out of the county after, and I know that that happens with some other tribes, and getting money out of the county after they've had an argument over water rights doesn't always happen.
I don't have a great, oh, it's working. Okay, I wish I had a really succinct and straightforward answer on that one, but I do not. The answer is that I think for commerce, unless it's something that we can handle within like rulemaking or internal process where I just have to go be kind of annoying to some of our leadership, it's on my list and it will be done. In a lot of these, there we go, that's my next thing, is that some of these things are going to have to be legislatively fixed because they are not correct the way they stand. The funds should not be going through 3 or 4 channels and leaving it up to the whim of a local government to allow the tribes to have their share. So whoa, I don't know, I may irritated someone. Yeah. So I will be I joke that I'm the pain in the side of our executive leadership, saying, what about the tribes? Make it easier for the tribes. I have a reputation at Commerce and I'm okay with it. And I think that this issue of sending the money all over the place is absurd. It should be easier. We should not be our own worst enemy, being Commerce, in getting funds into tribal communities. So I'm going to be taking a long, hard look at Commerce applications, Commerce processes, and moving them out of, oh, tribes can apply for this, to no, tribes are sovereign nations that have specific and detailed legal standing within the state of Washington. And let's be honest, state of Washington, like the legal equivalencies don't always match what some state employees perceive them to be. That's as delicate as I can state it. And I'm just gonna go kick the door down and say, no, we're doing it different.
So is legislative intervention needed to do that?
Well,
apologies.
I just wanted to clarify that because that was one of the points that we were asking for input on.
Yeah, and just to put it out there, I mean, this wouldn't be a secret to anyone involved. This is the Commerce's relationship with county governments. So the politics around that are intense, to say the least. So for instance, Commerce, in a program that I manage, had some ideas about distributing the money, and the county governments went to the legislature and got a law written that we have to give it to the county. So I guess there's a line between like what theoretically the agency has control over and then the politics that, I mean, I'm all about, like, we took a risk and we got beaten back by the legislature. I'm all about taking risks, but just sort of the context of, well, yeah, if we just sort of say, oh, we're not going to do what we've done for 20 years, we need to figure that out because there might be they're a powerful constituency.
Thank you. I'm Doreen Vargas. I'm the chairwoman of the Lummi Grandparents Committee, and I've been recommissioned to the Lummi Health Commission. But I do have history in working with a government contract with the state, and that's how I know Tim Collins, because about 10 years ago we did work together on that. And the pandemic kind of slowed us in between updating our contract because everything is still waiting to come back from the governor's office, but for our new agreement. But I can see that, you know, it is a challenge, you know, for this type, and I'm sure that we would prefer a government agreement in this matter. And having history and examples of what kind of choices of contracts come out of the state, we ended up, because we had an A, B, or C choice, and we tore them all up and wrote it, and which we would be open to looking at what kind of templates you'd be coming up with to see whether or not it's something that our tribe would agree with. But in lieu of thinking about what kind of housing we would need for our homeless and those that are in recovery would be is, and I would say, you know, rental assistance may not be a direct option, you know, because what I'm seeing right now is that they need to learn life skills. Many of them don't have any life skills, never been taught how to even manage money except buy their drug. And so transitional housing is almost an immediate need. To give you an example, we've already started a number of different types of and different levels of housing, which our housing authority has already started. Because we do have a men's transitional home, and our Victims of Care has a women's shelter, which the women's shelter is helping the women do with their life skills. The men haven't gotten that. That men's transitional home needs to be built up. Yes, we do have some homeless shelters for emergency assistance housing, but our housing has another Chelangen village to where it's a gated facility housing, to where they can, those that are in recovery are get full wraparound systems. They have counseling, they have meetings, they have group sessions, they're being watched, they have elder homes within there to help them learn how to be parents with their families. They're reuniting them as families again. And for something else, when they're just coming out of treatment or incarceration or whatever, families with children, We just built a new facility just to help them learn to become parents again. It's an 8 apartment buildings, 2 of them, to help them learn how to care for their children. They're monitored, and they have a kitchen, they have everything to help them learn life skills and how to be a family again. So I think an immediate assistance and where money really needs to go is to help them learn life skills at different levels, because they're all different. Some may have life skills, some may not have any, because some of these addictions are 3rd generations. So those are things that we really need to look at and consider when we're writing these agreements and looking at what our government is, wanting to fund. That, but that's what we're doing here in Lummi right now, because the completion of the new apartments for the new transitional homes for families has just opened up. And whether or not they have anybody in there yet or not, I don't know. But this is all created through our housing authority. They did it on their own. They have their own counselors. They have all their own everything right there. But it seems to work. And it's helping them learn how to cook, clean, pay rent, manage their money, so they can be able to graduate and go out there. Because housing is actually monitoring them of how they're succeeding within their own lives. They don't have anybody, it's restricted on who can even enter in, because they're all gated and protected. You gotta have background clearance, a drug test before any other individual can even enter those gates. And that includes any state worker, caseworker. They have to go through the housing authority to get that done. Their credentials from the state doesn't work. So I just wanted to put that out there. So these are things that we need to think about, at what level we need to look at on how making these agreements and putting that money to.
Can I ask you a question first before I give up the mic? So I heard you're building housing and then you're providing the wraparound services. Do you know how the wraparound services are being paid for, or is that an issue too that probably is not a commerce issue, but bringing the departments together?
That's through, they do have a grant, I believe, and the tenants do pay rent, and the rent is handled through that, and I think that's how it's all gone through, and it's through Medicaid, Medicare.
Maybe the Apple Health?
Yes, yes, most likely.
Yeah, okay.
Unless some of them do have jobs, and they may have other health insurance, but most likely Apple.
They're billing Medicaid for services, and if they have Medicare or if they have other insurances.
Mm-hmm.
Okay. Thank you.
One thing that I've been working with Commerce leadership specifically is trying to get our leaders to understand that the state does not know what is best for our tribal partners. We don't live in the communities. And I've even told my leadership, yes, I'm a tribal person, but I don't live in my tribal community. I'm in Olympia. My job is to tell you what I hear and not for you, the state, to decide what's best for any tribal community. And so hearing your story, I actually used to live here. I worked for Lummi for 10 years, and I've watched the Chelangan Village be built. And so it's a really beautiful story of how you get someone from one point to another, supported every step of the way. And so that's the philosophy I take to the state, is we don't get to tell the tribes how to do anything. We don't live in the tribal communities. So why are you putting all of these rules and stipulations on these dollars that in some communities is the difference between life and death? And so that's one of the things that, Ted, I'm going to throw you under the bus here a little bit. As we talk about legislative fixes, what can we do so that our programs that we receive from the legislature aren't so narrow in their vision? And I consider myself lucky as a tribal liaison because I get to do all sorts of great things that other leaders in commerce don't because of tribal sovereignty, of working with tribal leaders. So this is my big question, is who do we gotta talk to get whatever piece of legislation passed that says this money is for tribal housing? And so the tribes get to decide what to do with it. One example of irritating commerce leadership that I'm hoping to replicate across the agencies, we have CCA dollars, Climate Commitment Act coming in. And various folks have been asking, how are you guys going to distribute that? And I said, I'm going to ask the tribes. Because the legislation says this money is for tribes. Why would the state make any decisions on where and how it is spent? So I'm hoping that that kind of model we can bring over to housing, into social services, and I mean energy. It's important, we'll bring it there too. So I just, wherever the policy-minded folks are, just let me know who we gotta talk to and what we gotta write. And Vicki said she'll write the WAC.
So do we have other questions or comments on any of the areas that we want input on? Even if you want to go back and identify areas of concerns and changes that can happen with the current powers in the governor's office, you know, we're open to that, even though that was the focus of our first session. We really want to hear from everyone to make sure that we get your input, and really appreciate your input from Lummi on what you're doing. That's awesome.
Good afternoon. I'm Scott Russell, work with Department of Corrections in the Reentry Division. We had a conversation earlier, and I'd just like to restate, if I could, that I believe we inadvertently across the state may be competing for a very limited resource with transition housing. And so I want to make sure there's an opportunity for us to share that between state, local, and tribal governments, maybe there's a way for us to work in harmony rather than competing for a very limited resource until we get those resources where they need to be. And then also some of the challenges I heard this morning with justice-involved individuals that have a history, and what are barriers for them to obtain housing? You know, the inability to obtain a driver's license or identification, social security card, maybe a warrant or a detainer that they need help with to get resolved, and how we can help with other state agencies to partner together with you to help get those folks ready prior to their release back into their communities. So, thanks.
Would you say those are legislative fixes?
The governor's executive order 1605 does impart other state agencies, but I think there's opportunity for us to enhance that. We work with Department of Licensing in hopes of getting folks identification. But if folks have an expired driver's license or such, we would like to have conversation, and we are going to enter into that to expand what that might look like if we can get folks a driver's license in addition to state ID and or in lieu of a state ID, just as an example. And with the Social Security Administration also to get a replacement card for folks.
Because you can't get housing without ID? So last Friday we had a caucus and we talked about housing issues, and I just want to run a few things past you all. One of the topics that came up, and I think you touched on this, Chairwoman Evans, is the difficulties with the federal programs, and how because of that, tribes have started building their own housing, but there was an ask for increased funding for housing vouchers, and that would be an ask to the legislature, I believe. Housing vouchers for rental assistance. You know, you were talking about the ERAP program, and you know, a lot of funds went out to the urban programs for that too, and almost all of it went for rent from the money that the Department of Commerce gave out. And then one other thing that came up that I haven't heard yet in either conversation is provide opportunity to develop housing connected to the tribal medication-assisted treatment facilities or opioid treatment programs. And I don't know if how people feel about that. Well, I see one tribe in here that has a MAP program. Housing connected to medication-assisted treatment, or OTPs.
Thank you. I know a few tribes, including Squaxin, during the pandemic purchased tiny homes for being able to isolate and have and then now it's trying to plan what to do with those, and it would be nice if there are flexible funding that we could not only decide but improve them and figure that out, but also I imagine, depending on what's decided, some of the policies might include ensuring that somebody's in compliance with that type of program.
All right, thank you, Charlene. And then another thing that came up earlier was issues with non-native people living in housing with your tribal members, and really thinking through policies for your housing programs based on that. And then one other thing from last Friday was, how do we create more opportunities for low barrier tribally provided housing? And I think you gave some really great examples here at Lummi that you're doing all kinds of different types of housing. Any other thoughts on that? What kind of support do you need from the state, from Commerce, from the legislature to do that?
Example of why we would house a non-native is only because they are caring for our Lummi children, is when we have allowed them to live within tribal housing because they're caring for our children until they're of the age of 18. And that goes for any other non-tribal, you know, that's not a member of Lummi, but they are tribal. But the children, their grandchildren are Lummi tribe. Is the only other way, is we allow them to be within tribal housing. But other than that, you know, it's the only way we can let a non-tribal person live within our tribal homes.
So I think one of the issues that was brought up earlier regarding that was our tribal police cannot pick them up, charge them, can't put them through tribal court. So then we have the need to either work with the county officials and try to work together so we can provide a safe place for our members. A lot of times what happens is a tribal member may be bring in a non-tribal member that lives with them. And if there is disruption or breaking of law or they do something wrong and need to be charged with something, then there's issues with jurisdictional issues with the tribal police, the tribal courts, and so that creates a whole new issue for tribes to deal with, especially like my tribe. We can't cross-deputize without going back to the people, because in our Constitution we have a reserve power that we can't give up any criminal or civil jurisdiction without getting a vote of the people. So that's kind of interpreted in a strict way, so it makes it really difficult to try to continue to provide safe housing, a safe place for people to live. Yeah.
Yeah. Sorry, I had to go get some lab work, so I left. Is it this way? Okay, so really when we're talking about legislation, I think that if we were able to include opportunities or funding for tribes to clean up. So we've got two issues here. When you have somebody that's smoking in a bedroom and you call, and it could put that home at risk, whether it's powder or residue in the home, that increases the health risk of other people in there that might have respiratory problems. Then you're talking about $1,000 for somebody to come in and just do an assessment, let alone the cleanup of the home where there's been use or misuse of substance in that home. We've actually had elders that came home from the hospital and somebody in their family was using in the bedroom, and they were using fentanyl, and when they talk about the dust and the residue in there, potentially causing harm. So environmental cleanup, I think, and funding and resources to have somebody come in and do that home assessment is one issue. The other issue when we're talking about funding opportunities is that a lot of people will use these broken down freaking RVs for their temporary housing and just create a mess on the reservation. And the removal of those is very, very expensive. It's an eyesore. We live in the most beautiful place in the country. And the reservations are absolutely beautiful. To drive around the reservations and see these temporary shelters that have been used by people, regardless of the reason, maybe because of opioid addiction, it may not, but the bottom line is there's garbage around it, and to get rid of it when it's not habitable anymore is very, very expensive to dispose of it. So including funding and resources for tribes to clean that up, the environment, and to do assessments of the indoor air quality of the homes of those that have smoked substance in there. So those would be my two thoughts on resources.
Anyone else?
I thought I seen some more hands. I think regarding that, establishing the baseline for all of the houses going forward, I know at our tribe we talked about that, but just to even establish the baseline after someone moves out to test the home, the cost of that is large. It's a big cost, so that is important, though, because you could be putting other tenants or other people to move into those homes, and it's not a safe place. So that's a very good point. Thank you for bringing that forward. Okay, any other ideas on areas where legislative intervention is needed? because it's currently outside of the purview of the governor and the secretaries? Looks like a question for you, Ted.
Yeah. So I don't know how we create, you know, when we're in the economy of people wanting to make money in these facilities that my daughter pays $2,000 a month rent. She's a single parent with 4 children. You can't get anything less than $2,000. That takes, she has car payment, she has daycare, and other things, and she can't catch up. So there's no way that she could create herself an opportunity to catch up to be a home buyer, because she's always chasing her tail with, do I pay this first, or do I buy groceries, or do I pay rent? And so because she can't, our tribal housing list is so long, trying to get in, that has been a nightmare. And so it's ridiculous. The ability of people out there for big fancy apartments off the reservation to be able to continue to increase their rent. So.
Yeah, there was a number of rent stabilization proposals in the last legislative session that did not get very far, but they're definitely, I've already gotten the phone calls, they're still part of the conversation. You know, there's a wide spectrum of rent stabilization / rent control proposals, whatever vernacular you want to use. I think most of the ones being proposed would prevent sudden rent increases that can be very destabilizing in a way that's important to address, the destabilization of a sudden rent increase. I don't think there's any proposal out there that would actually meaningfully address affordability over time. So there could be, at least politically the way I read it, and it evolves all the time, and I could be completely wrong, but the way I read it, there's the possibility, although it didn't get out of the last session, of proposals moving through that would stop a sudden rent increase, but there isn't at this point a constituency enough to actually keep the rents low so they're affordable.
Okay, well, when we talk about low-income criteria and eligibility, we create a system where you keep people down. So you give people an opportunity to go to school, get educated, and then they increase their salary so they don't qualify for any of these perks for low-income housing, so they can't afford it. They're not making ends meet, but they don't qualify for these programs. So therefore, the threshold for low income really needs to be revisited for young people to try to get ahead. And that's the other, you know, we just keep people down, and it just doesn't allow them opportunities to grow. So the more you make, the more you have to spend on the cost of living.
Yeah, you won't get an argument from me in that regard, but as an explanatory function, because we're only able to serve one of the every 4 people who are eligible under the current criteria, part of the criteria is a way of rationing a limited resource, because it's not. The way that housing assistance works at the federal and state level is there's a fixed amount of money separate from the need. So it doesn't matter how many people are eligible, unlike food assistance, which flexes up and down as more people are eligible or less eligible. So for instance, we could expand the eligibility of the who's eligible for the housing, but the same number of people would get served. It'd just be a different, you have to apply some other filter at that point. We already do that now. Our programs under the state law, we're legally allowed to serve up to 80% of area median income, but because the resource is so constrained, it gets limited to other criteria.
Thank you. Maybe a new or separate program for when someone is starting to edge out of that criteria and their income, because that's so true, then you're worse off when you suddenly meet that income. But a program that's going to follow you for, say, a year to have offset costs for other things that you may need as you transition more fully.
Other comments, questions, thoughts? So I did talk with one tribe that decided that they had waited long enough for other opportunities, and so they had actually identified some of their CARES funding and actually some of the infrastructure dollars for housing, and they went off and they are building duplexes. That they finished the duplexes, they built some single apartments similar to what Lummy's talking about, but then they were building 30 units, and they were going to start them off as rentals and then have the opportunity after a certain period for home ownership. One of the problems they talked about is they actually separated this housing program from their housing authority, because the housing authority has all these rules, and they thought if they gave it to the housing authority, they were going to use those rules to keep it limited. And what happened is that it consumed their government administration. So their executive director became the alternate housing director, spending, just consuming his time to develop this program. So, I mean, there's, you know, I think the solution is to make the housing authority, who has the capacity, or the tribal lending program, who could maybe give the loans for people to build housing, but give them those options. But, you know, it's just everyone's trying different things to try to solve the problem of not having enough housing for all the different people with different sizes of families and different incomes. And it just makes it a very complex and tough issue to deal with, because what happens is, in the case you brought up, the daughter moves home with the 3 children, and then you have 2 families in a home with the parents, and just can't afford to live out on their own. And so then we have this overcrowding situation occur. And so it's just a real complicated issue with housing. So, but I think the important thing is that we're having this summit. I understand we're going to continue, so we'll continue to talk. We'll try to continue to work this tribe with the states to try to find ways to help the tribes build housing for their people that meets the needs of the tribes and of the tribal people.
Thank you. I don't want to have the last word, but that inspired me. We really need funding that supports staffing the program. So when we had ERAP, there's a 10% administration. We never claimed it because it's not enough to do anything. It's not enough to fund anyone. And I hear you on not having enough staff, but tribes face that so often. What we were able to do, but it took a lot of calls and effort on my part, is that our other grants where we had staff working, they allowed me to funnel some of my staff into doing that because they were serving the same clients. But yeah, that took a lot of fancy footwork, and building the staffing into that would be really helpful.
Thank you. And just one other thought is that in August we're having a national Tribal Opioid and Fentanyl Summit at the Lummi, and we're at Lummi, at the Tulalip tribes. And so is there a message or things that we want to work together with the state to bring to the federal level for that summit? Anything you want to say about federal housing programs?
So I have one comment with that. Hopefully that would stir up some thought. It would be really good if we could operate the NAHASDA similar to the 477 program. Because the 477 program, if you're running it as a 477 program, you have this plan, and then with the plan, you can develop your programs. And so it doesn't come down like the funding from this entity has to be used for that entity purpose, the funding from this federal entity for that purpose. It all comes together, and then you operate the whole program in accordance with your plan. And so that way you can use the funds across the different programs to help for the overall programs, for the overall 477 program, which can have several different programs under it. And so I was kind of thinking, gosh, if NAHASDA operated that way at the federal level, but then NAHASDA don't get enough money anyway to serve the need. But that would be a good model if we could get some state money put into that to run some of our programs that we've been talking about today. So there was one other thing that didn't get mentioned today, and I know it was talked about at one of our meetings in preparing for this summit. We have a lot of tribes that do not have housing for their providers or for their workers. So the workers are having to get housing off the reservation. Sometimes they're driving from distances. So that's a real issue too. You can't hire the doctors that you need, or the mental health, the licensed mental health workers. They're going to work somewhere else where they're able to get jobs and not have to drive the distance. So I know with housing, that's also an issue on the reservations. I know Colville Tribe has that problem, and at Spokane Tribe, we also have that problem.
And we also heard that daycare is an issue too for staff.
All right, do we have anything else? Any thoughts from anyone on housing, opioid, substance abuse disorder? From anyone in the crowd?
Do you want me to read what I have written down for tomorrow?
Yeah, I think that would be good.
So this started with a pre-conversation. So increase funding for housing vouchers, provide opportunities to develop housing connected to tribal medication-assisted treatment or opioid treatment programs. Department of Commerce needs to hold listening sessions and roundtables and consultation on the funding so Department of Commerce can partner more meaningfully with tribes to build needed housing. Each tribe will have a different need for their specific community. Housing programs also need funds for staff. We need workforce housing for providers in behavioral health and opioid treatment programs. Department of Commerce needs to initiate government-to-government agreements that don't ask tribes to waive their sovereign immunity. This erodes the federal trust responsibility. We didn't really answer the question about how do we create more opportunities for low-barrier tribally provided housing, so we might take that off unless that I can move that up to the conversations with the Department of Commerce, maybe that we have more conversations about that. Okay, need funding for environmental assessment and cleanup for homes after there has been misuse of substances in homes. Need funding for removal of motor homes that have been used and abandoned. Also need environmental resources, resources for assessments. Did I get that right, Barbara? Okay. Legislative fix to housing funds going to counties. Ask Ledge for tribal set aside for housing funds. Did I get that right? Is it a whack or a legislative fix, do you think, Ted?
It's a little more
It's
complicated than that.
legislature.
I mean, so this is the one that's really turning over my mind to just throw it out there. And the politics are insane, but setting that aside for a second.
Oh, I did write down, but I didn't put it in here, that we need to bring the Washington Association for Counties and Cities, WASAC, into the conversation.
Yeah. 'Cause it's,
And also, each tribe has an opportunity to have representation on the local boards of health. And I think sometimes those housing conversations happen in connection to those local boards of health. So make sure you check with your tribal leadership and see if you're being represented locally.
yeah, because to me, in some ways, that's one. I mean, there's a lot of programs at Commerce, but a lot of the housing ones are formula grants to county governments. So. We don't, like, there's a lot of activities that you described are eligible activities, like the Commerce, years ago, we used to be really in everyone's business. Like, we would contract with individual programs, we had all these sorts of ideas, and we took a step back and said, hey, county governments are elected to make decisions. Why don't we trust them to make the decisions? And we just put all the money into this thing called the Consolidated Homeless Grant, which was like 6 different programs with 6 different program managers who didn't talk to each other. And we said, here's a formula grant to county governments, write a plan, tell us how you're going to use it. So I guess that's how my mind is racing, like, hey, we've been here before in terms of let's get out of people's governance. And I think my concern with that is the scale involved. When I kind of do the rough math, the numbers would be very small, but that doesn't mean it shouldn't happen in terms of the dollar amounts. And then, of course, counties, the politics are insane because it's a zero-sum game and, like, telling counties they're going to get less. But just setting that aside for a second.
Well, and we can look to the work that was done with the Department of Health, because we did that for foundational public health services. All the funding we're going, I mean, LA local health jurisdictions were getting, they have consolidated contracts. They were getting public health funds. The DOH, Department of Health, and the State Board of Health were getting money, and nothing was going to the tribes. And now, this next year, this last biennium, for the first time, there are actually funds going to the tribes for foundational public health services. And then this next biennium, we're asking for funding to staff 1 public health person at each tribe in Washington State. And the local health jurisdictions, I think, because of how much tribes were involved in the pandemic and the response, are very supportive of it. So I think we can build off of that relationship. The WASAC is at the table there, Eric Johnson. And so I just think it's something we can work on. So sometimes you do that by putting out a piece of legislation and see who gets mad at you. Or sometimes you can, I mean, we should really bring them to the table too, because if the tribes aren't getting funds to do housing, then the counties are doing it, and they don't have the right tools to help our people with housing. That needs to happen from the tribes. So I think if we explain it in that way and compare it to the pandemic and how the tribes were able to, I mean, somebody said that last time they were in the event center, they were here vaccinating school teachers and healthcare workers who weren't tribal employees or tribal community members. So, I mean, there's some goodwill that we can build upon for that. And I think we just need to, and I'm not afraid. I'm like Michelle. We should work together more. We can just put it out there and try and work on it. So I'm going to keep that on our list. I guess that's my long way of explaining that. Everybody okay with that? Okay.
Is there anyone
So, yeah, that one of my staff people, they say that, oh, you talk a lot, but I heard somebody else say that, and I promote that in other people, so I'll say that's okay to myself. Expunging records is just so difficult, and I don't know how anybody could figure that out on their own. And I would guess that even people who were maybe found to be falsely accused and sued and won money for being falsely in prison probably try to go rent a place, and it's like, oh, but your record here is like this, is my guess. I'm not sure that's accurate, but I think legislatively, hopefully, maybe that could be something that we could start to look at. There could be certain types of crimes. There's things that we've worked on regarding helpers for elders and background checks for that at what certain type of crimes, but that an elder would feel more comfortable with than an outside provider. So those types of things where we've looked at what kind of records, and then finding a cleaner and better way to expunge records. I really dislike systems that get put into place where somebody starts making money. Bail, ton of money for private companies. It changed with licenses, and you don't have driver's ed in schools. There's all these driver's schools, and you have to go through them. They make a ton of money. I know people who've been successful at it, and a lawyer made a ton of money to get their record expunged. So those are always red flags to me if it's a system that suddenly there's an entity making a lot of money. So I would love to see a simpler way to do that, a clear path for people getting their records expunged. Yes, yeah, and maybe it's, maybe they were used by somebody else. Maybe it was a victim who didn't have a choice. You know, there's look at the type of crime of someone who's just been used versus someone who's living in a mansion somewhere.
And we can use the work that we've done on the background checks for people providing in-home care.
Yep.
Okay.
And, you know, I'm sure people would have strong opinions, and we face that from some of our non-tribal folks who were really appalled at first, like, oh, but you can't take this away, not really understanding the tribal piece of it. And we're not talking about murderers or anything like that, just,
Okay, yeah, that's stigma. So then I have caps on rent. There was a rent stabilization bill last session. There was quite a few, but there was actually one about landlords having to show why they're raising rent if it's over so much. It got a lot of pushback, I think. But I think it's what, was it you that was talking about? Yeah, Barbara. So I think if that bill comes back, then we need to make sure that our tribal leaders know about it and you know, get their lobbyists in Olympia supporting that bill. And then I wrote down, only house a non-native caring for tribal children. Tribal police courts have no non-jurisdiction. I don't know, I think that needs some help. And then state and tribal support at the National Summit in August. Support for NAHASDA to run more like 477 programs, is that right?
Yeah, that was just my thought. You know, I just know how we were originally a demonstration grant, but when it actually went past that, it just really made the funds more flexible so that the whole 477 programs ran based on the plan, not the funding coming into it.
So you have a plan and then you develop the program And that's how the funding works?
Yeah, so you could receive, you know, $1 million over here, but only 100,000 here, but this 100,000 program needs another 200,000. You could actually take some from that. You run it based on the needs of the program.
So is it more like bringing different funds together to run the program? Okay, thank you. So any other ideas about things that we need to advocate for at the National Summit?
One of the things brought up in our meeting, Vicki, and you might remember this, we were talking about the state of the undivided interest on reservations. You know, so we have this family that one time you had one landowner, and several generations later you may have 1,000 landowners for that one parcel of 80 acres. And so that becomes an issue for that land. You can't really use that land unless you get approval of all the landowners. So I know that was brought up in our, and then of course that goes to the Department of Interior, BIA, their system of, you know, how to address that. But it is a problem for tribes with that have that problem. I'm not sure if Lummi has that problem or any of the other tribes in the room, but I know we do.
So I'm wondering about funding then that helps tribes develop policy, or maybe where they need to do work on what their codes would be. So when I think of some of the housing or going in to do cleanup, I know some housing might have policies where, oh, we found this, now you're evicted, you know, and you would need to have, make sure that the policies wouldn't be punitive in that way, and then you need funding to do that work, to look at the codes and.
That's a separate item.
I'll let you decide.
Well, it's like we're doing with public health, building like model codes, and then, you know, working with the tribes to hear all of their issues, and then giving them back to the tribes and letting your tribal attorneys have their fun with them and then implementing them.
Yeah, we received, the Treasury had a template for policies for ERAP, and it was really useful, and that's exactly what we did. We worked with legal to make sure that, and altered anything that would impact sovereignty.
Okay, so funding and technical assistance to develop tribal codes and policies for tribal housing programs.
And just a little bit tangent here, just to clarify, I was thinking about the law in the last session. It actually would take a legal change now, because counties do have right of first refusal. That actually got put into law for the homeless money, so that would take a law change.
Right of first refusal for counties on housing funds.
It's in current law, yeah. Or more accurately, in law that goes into effect on July 20-something. So.
Is that related to the question of trying to give tribes a direct?
Yeah, yes, yeah, I just wanted to clarify that the governor could do that for the next 21 days or whatever, and then you'll lose that authority. So yeah, we need to take a law change.
Anything else?
Did you have any other notes from the morning that they might want to have some comment on? Or that was a long list, huh?
So we talked a lot about Oxford houses this morning or earlier. From this morning's session?
Our earlier session. It was actually afternoon, but now we're really late.
I had written down, we need to think outside the box. Wraparound services are needed and then those who are providing wraparound services are needed, and those providing the services also need housing. I think we talked a little bit about that. Chairwoman Gobin talked a lot about how every piece of this is important, so we can't just do part of it. We have to do all of it. Understanding jurisdiction over non-members, talk about that. Oh, culturally appropriate care needs to be funded. And we talked quite a bit. And I think that comes with the wraparound services. Do we need a legislative fix for that? I know that we're doing some work with the Department of Health to be able to look at culturally appropriate services and try and develop them into best practices so that they can be billable.
Yeah, I think that was the comment, that they couldn't bill for those type of services because it didn't fit under the category.
Okay, I'll add that. And transitional housing needs to be available for many years. Sometimes people have been in addiction for a long time and they need a long time to work their way out of it. So, a lot of times there's time limits to these programs, but we need to make sure that people get the time they need, not the time that somebody else determines. And there's need for mental health housing. And in Clem County, we just built, I'm on the board of directors for Peninsula Behavioral Health, a local behavioral health agency, and we purchased an old motel and turned it into 28 housing units. And because of that, I think 4 families were reunified with their kids, so looking for opportunities to maybe partner with the counties would be good too. So those are the things I wrote down from earlier.
Yeah, I agree. I think I have the notes from the earlier that includes wraparound services and the lack of supply of housing. Another thing that was mentioned was the barrier for those that are experiencing substance use disorder to access and just be admitted to housing, and what would it take to either change policy, legislative action, or if that's something that's under the control of a program, to just make sure that those that need immediate help have access to things like crisis housing. I think that was mentioned this morning as well. And so I wonder if folks in this session had thoughts around how to remove barriers for those who are currently, experiencing addiction to access housing, and remove the barriers for those housing that are currently being offered to not be that restrictive.
I heard 2 things. I heard mental health and then addiction. Could you clarify the question again?
The question was, how do we think about removing the barriers? I think, so this was brought up earlier. How do you think about removing the barriers for those that are currently experiencing addiction to enter houses that may have too restrictive of, rules? And so folks that need immediate help, are not able to obtain the housing fast enough.
I don't know how the program proceeded, but I did hear people earlier talking about harm reduction. But there was a program in Canada where people who were still in addiction, and I believe that was for people in alcohol addiction, they would actually get a certain amount of alcohol a day, but they found that it reduced how much they would drink, but it kept a stable level, and they had a place to live, but it wasn't where you had to be perfectly and away from addiction. But of course that was a little more fully staffed. It wasn't like having your own apartment type of thing, but I think harm reduction is something that could be looked at as well.
You just keep going. And I'm not that familiar with some of the definitions or the meaning of low barrier, but you did mention low barriers. So to me, that's part of the solution is the low barrier housing. And one of the things that you mentioned earlier, Vicki, that just was a little bit of a red flag. And for me, it's really, really important. Sometimes our health systems we know that we understand what pair of last resort means. We understand what the encounter rate means, okay? And that has helped, it has tremendously helped health clinics. And the other thing that has made a big difference in our health systems is really the Medicare-like rates, right? Those are really big legislative things that have impacted sustainability for health systems. But when we talk about housing, it's separate. And when we talk about those needs and we talk about culturally appropriate needs and culturally appropriate services, I think we just have to be very careful on trying to create making those billable. I think that really concerns me greatly when we're talking about spirit, or we're talking about gifts, and we're talking about Medicaid in the system. We don't want to create those internal conflicts with that. But what can help is flexible funding. And so when the Accountable Communities of Health was created to really look at Washington State and transforming Medicaid, our North Sound Accountable Communities of Health provided funding that was not restrictive. And I think the more we say to reduce barriers is increase flexible funding. Because if the tribes are saying we need to be able to purchase food for those kids for prevention, we need to make some of these opportunities more. And that's really the national thing, and it may or may not be. Part of it includes housing, but it includes everything else. When we talk about SAMHSA, or when we talk about IHS, or we talk about all of these partners that we have at the Fed level to increase opportunities for flexible funding, because tribes know whether it's canoe pulling, or whether it's softball, or whether it's food on the table, or transportation for prevention, those increase flexible funding. So that makes me think of the national level.
Yes, and when we talked about that, I almost shared that when we first had that conversation, well, I'm sure it's been going on longer than that, but like 8 years ago, and we met with the Healthcare Authority, and what David Reed, who used to work there and is retired, talked about, it's not that the traditional medicine is the service, it's that the services provided is like a behavioral health visit, and then if you do it in a setting where there's also traditional medicine, and I think that's how it's billed, it like the oncology clinic that Puyallup has. They do traditional medicine, but they bill as a regular service, and the traditional medicine is kind of incidental. So I don't know. I know it's a very sensitive topic. So I changed it to increase flexible funding for non-traditional services. Or complementary service, okay.
Right, we got 1 minute, and last time when I wrapped up after the 1 minute, and it started screaming at me, so I'll do it now. I just want to thank you all for your input. I think we've received a lot of really good input in both sessions, and I think we just continue to move forward, have some good recommendations for the governor tomorrow, and moving on to the federal one in Tulalip in August, right? We know that date, correct? August 20.
I think it's the 22nd and 23rd. Hold on.
But it's in August, so I know we got a little card on it this morning that went around the table.
No, it's being funded by different organizations. As far as I know, there's no registration fee.
Yeah, that's good.
But if there is a registration fee, would it be appropriate to use Foundational Public Health Services funding for that? Because opioids are a public health crisis, and also the opioid response dollars could be used for that.
Thank you very much for your input. We really value your input, and really, I think the sharing of everything you're doing in your communities is really helping the rest of us also. So thank you very much. You have a good evening. I guess we get to go to Culture Night tonight, and I know they really treat us good on Culture Night here. I've gone every time, and I'm looking forward to it. So we'll see you there. Lem lem, she uhoy.
Thank you.